Mm-hmm.
Oh man. So you coming up to Mulch Fest, I trust. Since you came up for the Ring Garden lighting, I figure Mulch Fest is like a natural between
Uh,
10 and 2 on Saturday.
oh, really?
We have little giveaways. Get away early. Yeah, because
Oh,
and also the test and trace people come in.
oh,
Yippee!
they are. Oh, okay, that's cool.
Yes. So get there early. 'Cause, they'll be there right at 10. I mean, you don't have to get there at 10, but they have a bunch of new initiatives they're rolling out. The vaccination campaign. I actually like the graphic for that. I think it's really nice.
Oh,
The
really?
arm. Yeah.
Yeah, these vaccines are rolling out ways very slowly.
I know.
But
Unless
at the rate they're going, we it'll
I
be the end of the year
try a
before.
hospital system. I mean, like the NYP gave it to people who needed it and didn't. I mean, people broke the line because it wasn't monitored. But the
Wow.
hospital systems are doing a lot better than New
Mm.
York. I mean, I think we should have kept it in health. I think we should have kept it in Health and Human Services. I mean, DOHMH.
Yeah.
It didn't make sense except you have a mayor who doesn't like women, smart women. So,
I don't think that's true. He's got a smart wife, so we ain't gonna go there about smart women. His wife is pretty smart. However, I think about him,
we'll
that's
have
a
to
separate.
agree to disagree. But I'm
Well,
just,
I won't because
I
she's a
know.
smart woman. Like I can have something against De Blasio himself, but I'm not gonna bring
I
her
just
into
think,
it.
yeah, I just
You
think,
know.
um, I think that he just thinks he's the smartest guy in the room, whatever room he's in, and that
Yeah.
doesn't necessarily work. I mean, I don't even know if it's just limited to how he treats women. It's just having lost two good heads of DMH, MH.
Yeah, that was a little problematic for sure. Because I actually the person who was there before, well, I think she was totally fine.
She
But
was
I
good.
don't think I think it's because it was like when you challenge status quo, you know how it goes.
Yeah,
You
and
start speaking up.
I've really never spoke up about anything. You know,
Right,
I'm
exactly. So
shy and
you know how that goes. So that's the demise. She had that demise because rumor
oh, wait
has
a
it.
second. We better take this offline. I see that the little recording thing is bleeding.
Oh, shoot. Okay.
Oh, well, pay on.
Oh well.
You
Oh
guys are
well.
live on Facebook, so just want to make sure you're aware of that.
Yeah, I know. I just found that out. I'm going to go back to being shy and retiring.
Oh, I'm sure these things people have heard before. These are not new conversations. Right?
Broadcast
So,
to America.
oh, the two people
That's
watching us
right.
right now.
I know. If I get kicked out of New York, I'm going to Georgia.
You are nuts. No.
Fine.
Well, I guess it's safer now, but yeah.
And also, they're the guy that was the chaplain at the cathedral school when Will was there. His first chaplain, who I love. He's also a bishop down there. I know a lot of bishops.
Oh wow.
Church. I know a retired bishop. Yeah. So I have like God looking over me and two senators. What more could I ask for?
Georgia.
I know. I'm so happy.
Yeah. Yeah, but now, like I said, it's all about how do you maintain it,
Mm-hmm.
We have it and we tend to sit on our laurels sometimes. And so you just have to how do you maintain it? It's not enough to just, well, we won now, but that's just the battle. The war is not over. So
Mm-hmm. Oh, not even close.
exactly. So we got to keep our eye on Georgia.
Guys, we're ordering Taco Bell. You want anything? Taco Bell.
I want Taco Bell, Pop.
Yeah, I have Taco Bell.
Oh, sorry.
Hey, we have
I'll take some Taco Bell.
Yeah, I'm not used to these modern times. I just finished setting up the live streaming. I'm trying to take care of two things at the same time. Hi,
Listen, we're
y'all.
feeling
No,
you.
Happy New Year's.
Happy New Year.
two
We
things at
feeling
the
you.
same time is just not enough for you, Pamela. You can generally do about 20 things at once. The way
I was trying, Sally.
that is so good. I love my payola emails and your comments.
Yeah.
I love knowing that you're running things down there. Makes me feel so represented.
Thank you guys. It's appreciated. Well, there's a lot of folks coming on now. We're just missing Steve. He should be in shortly.
Cool.
Good. Awesome.
Is Daryl on?
No, I don't see him yet.
I'm so excited about Saturday. You really should come to Mulch Fest.
I mean, I have something I have to do out in Brooklyn in the morning at 9, probably to like 9 to 11.
Okay.
But if I do stop over to be later, it would be,
Okay.
closer to,
They'll
yeah.
be mulching till 2, and you might
okay.
miss Lorian, but you see her tonight on this meeting, and
I'll try, but I'm trying to stay in the house. We got a high COVID rate up here, so I'm not hanging in too much because of that. So just so you know,
Very good,
like,
Tanya. Because I
yeah.
just heard the rates. We had 17,000 infections in New York State.
Yeah,
So it's
I'm
not good.
Yeah.
Hey, Sandra,
Yes. Hi.
Hi, Sandra.
how are you?
Happy New
How's
Year.
the family? Happy New Year.
Sarah, I love this. Where are you? It's so spring looking. So butterflies.
In Inwood Hill Park, we did a butterfly release with the kids. We built the first butterfly garden I built with folks in Inwood was at PS 98 in 2017.
Oh, that's beautiful.
And so that was at a butterfly release. And that's actually a real butterfly that's not photoshopped.
Wow.
Fancy girl.
Right? I know.
Yeah.
I hate, the one thing I hate about photography is that everybody can, I'm such a techno idiot. I can't do anything with making things look fancy. What you see is what you get. I didn't take pictures. So, Tanya, the picture of the butterfly climbing up that building got selected for the show I told you about.
Oh, wow.
Yeah. So I was pretty happy. They only took work from 8 artists. So, yep.
That's great. It's a beautiful picture, though.
It is.
So, oh, not this one, Sandra. This is another one I took for a show that used to be called Ins and Outs, of a butterfly climbing up my screen, but it looked like he was climbing up the building outside my window. It's really bizarre. You look at it and it's like, is that Butterfly Man climbing up that building? So,
wow.
It opens next Friday, I think. I mean, the thing is, openings now for all these shows are online, so it's not, I mean, it's fun, but it's not, you don't have the wine and appetizers.
Yeah, it's different. It's different. It's a different experience, especially with art, doing it online. It's a very different experience. So,
yep. I know.
But stay in the house until these vaccines roll around. That's all I have to say, because essentials only. Essentials.
Well, I think the hospitals, I think NYP is doing a good job. I think Langone is doing a good job. I think Sloan is doing a good job. The hospitals that know how to do things, their percentages.
Well, I think, we'll talk about that a little bit today, but I think we need to start now doing a good job at educating. There's still a lot of fears out there.
Yep.
So I'd be interested to hear today's presentation on the rollout, because I think that's one of the major concerns, that we'll have vaccines and no arms to put them in.
Well, the good thing is we have Lori in here from Health and Hospitals, and she's actually coming to Mulch Fest this coming Saturday. So if you want to hear the latest and greatest from Health and Hospitals.
Absolutely. We need to work on that. So I'll stay tuned.
She's a track and test and trace person.
Okay.
All right. Don't jump too far
We've
ahead.
been doing our meetings, Steve. We just started.
Yeah, I see that.
We do sort of a chat version. We don't go by agendas and that nonsense.
Yeah.
Steve, I
Um,
never want to hear any comments about uptown time. coming
Barbara is
from
here.
Constituencies.
Okay, okay, Betty Lehman apparently it was in the hospital. I got an email from her that she just came back from the hospital. But Paola, would you know anything about what happened?
No, I hear it from you now. No, not aware.
Hi, Tanya.
Hi.
Okay, is
Looking good, Miss Tanya.
Paola, is Francisco Alvarez still on our committee?
From what I know.
Yes, he is.
All right. Is he on the call?
No, but you have quorum, I believe, already.
All right. I think I just saw Tanya. Is
Yes.
Daryl Cochran here?
Yes, I'm about to give you co-host view so you can see everyone that's on the call. Even though you should see it already, just go to your participants tab.
Oh God, what is okay.
I don't see Daryl.
That's because he's not on the call. If you don't see his name, he's
Okay.
not on the call.
Okay, I don't see him on the call. Okay, I don't see Catherine Diaz. I don't see Naisha Diaz. All right, I see Sally, I see Barbara, I see Jay. 5, 6, 7, 8, 9, 10. Well,
We have quorum?
not really.
Not really. It's yes or no. No, really is not an option.
Okay, well,
You have Mary Anderson, Richard Allman is on the call too.
right.
Yay, let's get them both back on the committee.
Yeah. Do I have any other board members or just the two of them?
Just the two of them.
Okay. All right. Well, we can start. I mean, we're supposed to have 6 for quorum, but we only have 5. But we'll live with it. All right. So we're calling the meeting to order at 7:11. I think that means we qualify for a big gulp or whatever it's called.
Yeah, Slurpee
It'll
time.
go with our Taco Bell that isn't going to be delivered by Paola.
Yeah, we're on Slurpee time.
Okay. Okay. Please watch your language. Okay. All right. So I had hoped to have a presentation tonight by DEP of the drainage plan for Inwood that was provided for under the Inwood rezoning. They told me that they weren't going to be able to get it together for tonight, so we're now scheduling it for February. There are a couple of mistakes on the agenda. The presentation by the Department of Health and Mental Hygiene will be done by Padmore John. I have his name in the wrong place on the agenda. And Pauline is around for backup. And Julio is on the call, right? Julio, are you here?
Yeah, he's, I see him.
Yeah, okay. All right. So I don't know why it says to be confirmed. He's confirmed. All right. So we're gonna go through our standard reports on COVID-19. And then we have a special presentation by Katie Hanna from the Manhattan Solid Waste Advisory Board about zero waste. She'll be joining us a little bit later. You may recall that she spoke to us a couple of years ago on a similar topic.
Yep.
All right, so let's get started. Padmore, are you with us? Padmore? I thought I saw his name.
He's muted.
Why would somebody mute him?
Good evening, everyone. How are you doing?
Okay, Padmore.
Hi, Steve. Thank you for inviting me. Thank you for the opportunity to speak.
All right, I can't believe we're corresponding now twice within one day.
Can you believe it?
No, I don't believe it.
Thank you so much.
All right, but let me just start, however, with a little bit of a report on the latest statistics on the positivity rates in our 4 zip codes. And I tell you, Padmore, I just checked the DOH website,
Yeah.
and it looks as though there was a change. It looks as though the positivity rates, although they're pretty bad, are not as bad as the numbers that you showed me this afternoon.
Oh, well,
So
that's good to hear.
So I mean, they're sky high, really, by comparison. But there was one zip code that was over 10% that on your chart this afternoon. But all of our numbers are basically either 8 or 9%. Our worst zip code is 33, which is at 9.31%. This is for the week ending January the 4th on Tuesday. Zip code 34. So I'm sorry. Zip code 33 had 156 cases. Zip code 34 was at 8.84% with 117 cases. Zip code 40, 8.83% with 111 cases. Zip code 32, 8.46% with 174 cases. So in the week ending, the week between December 29th and January the 4th, there were 558 cases in Washington Heights and Inwood, which is not very good. So want to hear from you, Padmore, as to how you think, why you think this is happening, and what is our strategy for dealing with it?
Thanksgiving.
Well, yeah. Unfortunately, I think not just Thanksgiving, but probably a lot of travel during the holiday season. There were a lot of folks that were moving back and forth. Of course, the Department of Health and other agencies were putting things out in terms of travel restrictions, suggesting that individuals try to travel as least as possible. But I think that there were still a lot of people who were traveling a lot. There was an opportunity for folks to get intermingle, and for us and everyone to share and pass the virus around, unfortunately. So that is why we are still suggesting that even though the vaccination campaign has begun, that individuals continue to practice the core 4, wear masks whenever you are going out, socially distance 6 feet away, wash your hands often, sanitize when you can't. And of course, if you're feeling sick, stay at home. And we are also encouraging everyone to get tested as often as possible. The more you know, the better you have the information about what you can do. And of course, that if you do test positive, just being able to access the resources that are available, whether it's the hoteling program, whether it's assistance in getting pharmaceuticals, access to resources such as food, and other support as well. So unfortunately, that is the case where recently there were a lot of increase in the positive tests. But of course, we are encouraging everyone to continue to practice safe distancing and mask wearing.
Yeah, but it's our numbers in Washington Heights Inwood are apparently the worst in all of Manhattan. I mean, I don't know. I find it hard to believe that our people are traveling more than anyone else in the borough. I mean, maybe there's some other factor involved here too.
Well, that's a good question, and Steve, I think maybe some of the folks on the board might be able to provide some assistance with that. Whether it's in terms of making sure that the messaging that we are putting out are getting to the folks that require it, and that could be access in language, access in materials. So if there's certain spaces that you think that we can be able to get further access to, that's helpful. Ensuring that folks, the messaging that is going on, that they're abiding by that message. Whether it's to if you're going out, obviously outside dining, that's a contentious issue. There's some restaurants that may have outdoor dining, and they may essentially be almost indoor outside. So that's an issue as well. So I think it's a matter of making sure that we are very consistent with the message. And if there are certain places, certain spaces that we are missing with that message, for us to be able to ensure we're getting it to those spaces.
I think
And there may be other things that, and I'm sorry, sir, I'm happy to hear what you have to say.
first of all, I love your art. So not
Thank you.
sweating. I think it's a combination of the travel. I think it's COVID burnout. I think it is the restaurants, because those little outdoor or indoor masquerading is outdoor. They're all over Inwood, and I'm not sure what Mayor's Office of Special Enforcement is doing. I feel bad for the restaurants, but you know, to the extent that there's little super spreader pods all over our neighborhood doesn't help a lot. I also just wonder where you're putting, I guess my question is, where the advertisements are being put out? Are you utilizing local media that is read, like the Manhattan Times, certain radio stations? That's where you'll get your bilingual crowd, probably more, you know. And also we're going to be doing Mulch Fest this weekend, and Lorianne will talk about it later, but we're doing the Test and Trace Corps is coming there, and so they can talk about their new campaigns.
Yeah, so we have been working very closely with Laureen at Test and Trace. She can definitely pipe into as well. And Pauline, please, if there's anything you want to chime in as well. But I think we have been getting messaging in a variety of ways, whether it's on the ground where we have been there handing out flyers. We have also been working with our elected officials and community boards, of course, in terms of getting messaging out, distributing PPEs as well. So those are some of the strategies we have used. Of course, there is limited in terms of the different spaces we can go. We try to be as much as possible in some of the more congregated areas. But if there are spaces that you think that you're seeing some challenges in terms of people properly socially distancing or not utilizing masks, we'll be happy to know and see how we might be able to go to some of the spaces as well. Lorraine, Pauline, anything you may want to add?
And you're always welcome to come to Mulch Fest. You can bring your holiday greenery, have it chopped up and take it home with you. We have a chipper at Inwood Hill Park.
Yeah, well, I think they need to do a lot more than Mulch Fest, but, okay.
I think that's the most important thing.
Well, we'll do that and more as well.
Okay, good.
Cool.
I'm sorry, did,
I think Lauren wanted to say a few things. We can't hear you, Lauren. I don't think we can hear you. We still can't hear you. So I don't know, maybe you may have to call in or sometimes. Pauline, if you want to jump in while Lauren gets on the call.
Yeah, I just wanted to echo what Padmore said, but we do, I mean, we have those media campaigns, we do have paid advertisement, and we do try and get into ethnic media as well. So Spanish language, Chinese, some other languages, and we try to have all of our information in multiple languages, but we definitely understand that there is a gap and that we need to do a better job in reaching folks who may not typically look on a government's website or pay attention to, information that's coming straight from the government. So we really are looking for leaders in the community to help amplify our messaging. But we do really try our best to reach people whose English is not their first language.
Right.
Steve?
yeah, one second. Padmore, did you finish what you had in mind as your presentation?
No, I haven't started. I just really responded to the question that you started off
Okay,
with.
let's,
There's
okay,
a
I'm sorry.
lot more in the presentation, but I just
Okay.
respond to you.
Okay, let's, I'm sorry, Tanya, we jumped the gun earlier. Let's hold off on our questions. Let him do his presentation.
If possible, can I get the share screen capability?
Yeah, Paola, can we do that?
He already has it. All your
right.
panelists are ready to share screen for the rest of the night.
Okay.
All right, thank you. Let me just start.
Okay, and Natalie, I have you on the list too.
Okay, so I'm gonna go through some of the slides. This obviously will give a basic information about what we as the Department of Health currently, as things stand, what we are looking to do. It will give you some idea in terms of where are some of the things that we're talking about. Focusing, of course, in equity. One of the things we want to make sure that everything is grounded in equity. Where we are right now, what are some of the vaccines, what has gone on into the vaccine development, just to demonstrate its efficacy and its safety. Talking about the vaccines themselves and the distribution and the process by which the population will be getting vaccinated. So we wanted to start off with equity. We have recognized that, some of the places and spaces that have been most impacted, and affected by COVID, whether it's how the most detrimental in terms of illness and deaths in the community, and also from what we have seen in terms of the lack of being able to get appropriate and enough testing in certain sites, right? So we want to make sure that as we are going forward, that the Department of Health is grounding its response in one that is of equity, recognizing that part of this also is the fact that some mistrust of the government, right? Unfortunately, through a history of a variety of practices that may have been detrimental to certain communities. We want to make sure that this is the way we are going to be proceeding, that everyone is aware that equity is going to be a significant aspect of what we will be doing in terms of ensuring that a variety of community groups, people of color, immigrants, LGBTQ, and other groups have access to the vaccine, and also have messaging around the vaccine so that they are properly informed in making a decision on going forward with getting the vaccine. So some of the things that we're going to be looking to do, specifically to address that, is opening vaccines in communities most affected, vaccine sites in the communities most affected by COVID, ensuring that there's language and appropriate and culturally sensitive community programs and outreach materials, partnering with community-based organizations and community leaders. That includes you, of course, listening and responding to community concerns and input. I want to just let everyone know that right now a lot of this stuff is being built as we speak and being incorporated in a lot of the way we are responding. So this is an opportunity for us to be able to get some feedback from you, but we are also developing very specific mechanisms that you'll be able to do that, whether you're interacting with us or basically to be able to go online or to give an information through a phone call. But some of the key things we want to make sure is that the vaccines are safe and effective, that they'll be free for everyone, that they'll be available to people of all immigration status, and that when people receive the vaccine, their privacy will be protected. So this is some of the numbers, the latest numbers that we have. So the way the system is working, I know sometimes it seems as if we're not federally coordinated on a national and state level, but there is, in terms of allocations of vaccine coming through from the state. This is the number that New York City has received at the moment. This is 487,375 is the number that has been delivered to New York City. From once it's delivered to New York City, it's allocated to hospitals and other sites where they are undertaking some of the dosage on their own. Sometimes it's being done by the OHMH. And for those that have received the first dose is 144,237. For those, obviously, it takes a little while to get that second dose, in some instances 2 to 3 weeks. And it's for those who have received that second dose is 5,695. We're obviously on the bottom. I will also include the link to that vaccine data page. I was trying to put it in a chat actually, and I didn't see the chat. But if I'm able to get access to the chat, or one of my colleagues might be able to put it in there. But this is constantly being updated, so you'll be able to see where things are on a daily basis. So we also just want to stress that, and I'll reiterate, that even though as a vaccination process is ongoing, we're still asking that for safety in terms of preventing the spread of COVID-19. Make sure that you're staying home if you're sick, keeping that 6 feet distance, wearing a face covering, keeping your hands clean, and of course, getting tested. So I make sure that everyone has a very clear what the vaccines are, what they do, and how they're going to be helpful in protecting and stopping the spread of COVID, right? So these are the vaccines that are to help develop immunity within your body. They do this either by preventing you from getting the symptoms or preventing people from getting it from the disease in the first place. There are also many different type of vaccines, but at this point in time, there's only 2 of them that has been approved. So there is, once you get the vaccine, there's an opportunity for you to get individual and community protection. Vaccines provide protection to the person, but they can also protect the community as well. So that's why it's important that we want to try and get as many people vaccinated. We want to also be very clear and very open about items about the vaccine, that no vaccine works 100% of the time, and some people can be vaccinated can't be vaccinated because of a medical condition or because the vaccine has not been approved for some groups. And we'll go into that a little bit, but at this point in time, specifically for children. So there's a pretty lengthy process in terms of ensuring that the vaccine is safe. And we'll just go through that briefly. And also, once a vaccine has begun to be distributed to the public, there is still monitoring to ensure that it's safe and we're getting an idea of how it's protecting the individuals who've been vaccinated, as well as if any challenges or other conditions come up. So there are 4 phases to clinical trials for before a vaccine can come to the public. So as you see, it starts out with phase 1, a small amount of people. Once it's proven to be effective and safe, it moves on to the next level. And each time we're increasing the number of people. When it reaches phase 4, up to thousands, but it can be tens of thousands of people, sometimes even hundreds of thousands of people, to ensure that it's still safe and effective. And as indicated, after the vaccine is starting to be delivered in the public, we're still doing studies and monitoring for vaccine safety. These are the organizations, or I should say the FDA and parts of the FDA that are very specific in the authorization process. So before the vaccine, and many of you may have seen this on television, the Pfizer folks and the Moderna folks went before the FDA, demonstrated the efficacy and the safety of the vaccine. There were questions, there were answers, and eventually the FDA gave the approval that it can be used for the public. So right now, the vaccines are being used under something we're calling the EUA, the Emergency Use Authorization. So all vaccines are issued in an EUA must go through the same clinical trials as all other licensed vaccines, and that's where they are right now. Sometime later, they would the opportunity for public licenses, but at the same time, they only really have the Emergency Use Authorization. So these are some of the agencies that are conducting vaccine safety monitoring. As I said, even after they have been decided to be distributed into the public, there's still monitoring that occurs. And these are some of the institutions, but there are also other, when you say clinical research organizations, these are some of the large hospitals that we have in the city that are conducting their own trial, making sure that there is no unexpected consequences of having the vaccine. So these are the current vaccines that are currently available. And just want to go through really quickly in terms of the development. I know there is a lot of chatter about how quickly these vaccines were developed. Yes, that's true. And I think we have to recognize that one, some of the techniques that were being developed for these two vaccines, the vaccines that have been approved, they have been ongoing for quite some time. And also because of the nature of the pandemic, it allowed many companies that typically would not have worked together to begin to work together. There was a breakdown when the vaccine was initially identified. It was all the information was shared across the board by all researchers and investigators, and sometimes that's just not typically done. But in this case, it was done because recognizing the adverse effect it was having on the entire global population. And it really was a whole bunch of scientists that came together, recognizing and working together, and they were able to do it in such a quick and efficacious manner. So currently, the two vaccines that are being distributed, utilized in the US and specifically in New York City are the Pfizer-BioNTech mRNA vaccine and the Moderna mRNA vaccine. The other vaccines that you see, they're in various stages. They have not reached the phase 4 as yet. They're still under clinical trials. They still have to demonstrate that they are safe and effective, but hopefully at some point, all of these will be demonstrated as being safe and effective, and they can be introduced into the larger general population. But at this point in time, only Pfizer and Moderna are being used.
Yeah, let me just cut in for a moment because two of the clinical trials that are underway that are on that slide, the AstraZeneca and the Johnson & Johnson are being conducted, I guess, at least in part, at the Columbia University Medical Center. And Sandra.
Correct. Yeah. We're also going to participate.
Not yet.
Okay.
Not yet. Not yet. I want Padmore to finish, but I want people to know that when you come back, when it's your turn, you're going to give us some more detail about those two trials.
Thank you. And we also encourage individuals to participate in trials, especially from our communities of color, because that's when we demonstrate and know what impact and how effective they're going to be. And also demonstrates openness and trust by also participating in that. So we're good to know that Columbia is conducting some of these trials. So the mRNA vaccine technology, this is the way it works. And I also want to give the analogy of an email that contains a message. So just imagine your computer has a virus. You will get they'll send you an email, and within that email has very specific instructions, much like the vaccine, about how to, one, identify the virus in your computer, how to build an effective antivirus system, and how to destroy and remove that virus from your system. And then after it delivers that information, that the email disappears, right? So that's pretty much what's happened with the mRNA technology. So in this case, what the mRNA is, the messenger RNA, it basically is a message that is delivered to your cells that tell your cells, one, how to identify the very specific aspects of the virus itself. And we know that part of the reason why it was such a terrible impact on us was that our bodies had never seen anything like this before, especially the spike proteins that had this. So being able to identify the virus as something that is not good for our body, that's one of the key things that the virus, the vaccine is going to do, and then tell our body how to remove that virus. So that's the process. So for the Pfizer vaccine, and I know Sandra may be able to add to this a little bit later, for phase 3 of the Pfizer vaccine, there were over 44,000 volunteers that participated, and this is globally. But of 30% of the US participants were from communities of color, and of these, approximately 23% were Black or Hispanic / Latino. right? And then 45% of the US participants were between the ages of 56 to 85. That really helps us to be able to know what impact is going to have on individuals within those different demographics. So why it's very important that we have as much a diverse group of folks in the trials as possible. Ultimately, this particular vaccine had a efficacy rate of 95%. And just to think of it simply, if you have 100 people received the vaccine, only 5 of them may have gotten the actual become sick from the virus. The other 95 were protected adequately. And there were no serious safety concerns found with the Pfizer vaccine, which is why they received the EUA. For the Moderna, there were over 30,000 volunteers. 37% of them, the US participants, were from communities of color. 6,000 people, another 3,000 that were Black or African American, and 23% of the US participants were over the age of 65. And in this case, they had a 94.1% efficacy rate, which is really fantastic. So there is some difference, and some of you may be saying, what's the difference? Well, there is some difference. One of the key differences is that the age groups. The Pfizer vaccine in the clinical trials, they started at the age of 16 and up. For Moderna, they started at the age of 18 and up. So for Moderna, there is no one who should be getting the vaccine who is under the age of 18. For Pfizer, no one should be receiving the vaccine who's under the age of 16, right? So that means for anyone who's receiving vaccines, they have to be 16 and above. Children who are 16 and younger, it's not recommended that they get a vaccine at the moment, but we do know that there are clinical trials ongoing to determine the efficacy and safety for those age groups, and they will be provided to them at a later date. But at this point in time, only 16 and older should be receiving the vaccines. There's obviously some things that we still don't know about the vaccines, right? And so this is part of the ongoing clinical trials, how long the protection will last, whether additional doses will be needed in the future, much like how we get the flu, we get a flu shot every year. Will we be needing something like that for the vaccine, for the current vaccines? We do not know. Whether being vaccinated prevents people from spreading the virus to other people, we're still not sure about that, but that's what we will be able to get in the coming months. And of course, I think it's also important that we do not know how effective the other vaccines will be. They might not have that high efficacy rate, or they may be higher. And we also unsure whether there'll be 1 or 2 doses. So the vaccine distribution that's happening, and it has begun, right? I showed you some numbers. Predominantly those vaccine distribution has been happening in hospitals, but they're starting to be sparsed out to various locations now. And as you may have heard, the mayor is making a special push to be able to increase the number of vaccinations that are happening on a weekly basis and a monthly basis. And that will, of course, allow us to open up and need us to open new vaccination sites. But the state is allocating the vaccines to the city. And so we have to wait on capacity, right? So even if there may be other very important priority groups that are ready to get the vaccine, we have to make sure that there's enough capacity to be able to do that. And the second thing is New York State's prioritizing the population that is getting vaccinated based on the CDC's Advisory Committee on Immunization Practices. So the CDC provides a guidance that New York State follows, and then New York City follows when New York State is the guidance that they will be given. So as many of you know, a lot of the healthcare workers are currently receiving the vaccines, people in nursing homes, frontline healthcare workers, right? That they're receiving the vaccines. Other groups that are being prioritized are essential workers, and we're in the process of open it up and determining who is can be identified as an essential worker, and of course older adults, which we saw that they were having such a negative impact by the COVID. So as indicated, we're going to go through a list of priority populations for quite some time based on CDC, based on the state, based on capacity as well, right? And so as more of the vaccines come on, the other 4 vaccines that are in this pipeline of development, we'll be able to know there will not be widespread distribution until that point. And that won't probably happen until the middle of 2021. So by April, May, June, that's when we can see the larger parts of the population being able to get access to the vaccines. So I think part of it we want to demonstrate is that there is benefits to getting the vaccine. The vaccines are safe and they're effective. You know, we all see the impact of COVID-19 in our communities. And it's also, it not just protects you, but it also protects people that are around you. And as we say, it's protecting you and the community as well. So we want to make sure that the vaccine is accessible to as many people as possible. So we're going to be doing these webinars ongoing. This will not be the first and last time you see me, Steve. I'm going to be coming back as we get more updates, as we get more numbers. We're going to be providing that information as well. But we also want to make sure that everyone knows the process by which the vaccination is going to be ongoing and where you can go to get vaccinated. So very important, there will be no cost to anyone to get the vaccine, right? We want to make sure that there is no barriers to getting the vaccine, and also that regardless of your immigration status, to be able to have access to the vaccine. As I said earlier, children less than 16, because of the fact that they were not part of the clinical trials, they will not be able to get it. And for some groups, such as pregnant or folks and women who are breastfeeding, we ask that you have a conversation with your healthcare provider before you make a decision of getting the vaccine. It's very important that you speak with your healthcare provider. So we will, once the vaccine is eligible for everyone, and we're able to have it in a lot more spaces, you'll be able to get it from your healthcare provider, community and hospital clinics, pharmacies, urgent care centers. We also will be opening up what are called pods, point of dispensing, across the city. Some of the DOHMH clinics, one or two of them that are currently conducting vaccination, they're going to be open a little bit more widespread. So nyc.gov/COVID vaccine, that is your New York City vaccine headquarters. Go to that website and bookmark it. Go there often, check and see what's happening. It will tell you when you're eligible, what are the priority groups that are currently being served, and where are some of the spaces that you'll be able to get access for the vaccine. So as I indicated, the vaccine there are 2 doses, at least the ones that are out right now. You're gonna get first dose and then wait a couple of weeks. In the case of Pfizer, it's 3 weeks. In the case of Moderna, it's 4 weeks for you to get that second vaccine. So make sure you get your second dose. When you do get vaccinated, you will get a card, and that card you can take with you. Make sure that you return. It tells you the date when you'll be getting that your second vaccine. It tells you which vaccine you get, because it's very important that if you got the vaccine Pfizer first, you get the Pfizer second. If you get Moderna first, you should get Moderna second. So for everything, there's always the side effects. One of the first side effects that some folks have gotten is that the pain in the arm where they got the shot. Sometimes there's elevated body temperature. And these are more or less common when you are when demonstrating that the vaccine is starting to work, right? So it's not anything to be uh, disturbed by. It is common. And also after you get the shot, we are encouraging people to spend at least 15 minutes in the space where you receive the shot just to be observed in case any type of reaction occurs during that time. We are encouraging everyone, even before you get your vaccine, to speak to your healthcare provider. And if you do start seeing some side effects, speak to your healthcare provider. There are some common side effects that you can expect, just to, so you won't get alarmed. But if there are something that is persistent, you can speak to your healthcare provider for the latest information. So there has been a lot of things in the news about allergic reactions, but as of course, sometimes something you hear once or twice, it's magnified in the media, and we kind of just think that it's happening all over. They're not that uncommon. However, we want to let you know that some of the reactions are they are not too uncommon, right? But just to be aware of this is something that is natural. And in some instances, we just to make sure, as I said, to be able to make sure that you're being observed after you have received the vaccine, and to again make sure that you're in communication with your healthcare provider. So again, after the vaccination, still continue to practice the prevention measures that we have talked about before. Just because you get the vaccine, it's gonna, as I said, it's gonna take, after you get your second dose, it's gonna take a little bit of time, even after that, maybe a week or two, for you to really get the full impact of the benefits of the vaccine. So don't think that, hey, because I've gotten my second dose right away, I can just walk around with no mask and I can just talk to my friends as if nothing has ever happened. There's no pandemic going around. You still should be protective of yourself and as others, as even though you've received the second vaccine. So what you can do now is keep getting tested, of course, as I mentioned, keep practicing the core 4. Go on our website to get accurate information on when you might be able to get access to the vaccine. Use our social media kit to amplify some of the important messages, and we can put a link to that in there. And there are some folks who obviously they feel very positive and powerful about receiving the vaccine. We know that it's going to have a significant impact in our community, and we want to get as many people as possible to be able to amplify that as well. And that's it. Thank you. I'm going to stop sharing my screen, and I'll open up for any questions anyone may have.
Okay, well, thank you. That was a pretty thorough presentation. Thank you very much. Will you be able to forward that to me so I can incorporate it into the minutes of the meeting?
Yes, I will. I'll send it to you as a PDF.
Okay, let me just ask a couple of questions. Will the other clinical trials, the ones that are underway or that are forthcoming, will they include people under the age of 16? Do we have a long-range plan to cover younger people?
I cannot say for sure. I can get back to you. I'm not sure if Pauline may know. I do not know for sure if any of those specific ones that have the 4 are included be under 16. But I do know that Pfizer and Moderna are conducting trials with individuals under 16. But I'm not too sure for sure if the other new 4 that are coming up.
Pfizer and Moderna have not.
Right, they haven't, but they're currently doing it.
Oh, they are. Oh, they are. Oh.
Yes, so they're currently, right. So Padmore is 100% right. Pfizer and Moderna are currently conducting trials with folks under the age of 16. And with regards to the other ones, I also don't know. So I'm happy to follow up with our team here.
No, but at least there are some trials underway to include that age group. So that's good to know. And with the long-range plan to open up sites in the communities that are most affected by COVID-19 vaccine sites, I have to assume that will include Washington Heights and Inwood. Is that a reasonable conclusion?
That is very reasonable, Steve. Yes, we will definitely be working with the board, other elected officials, other facilities and sites that are available that can accommodate being able to see a certain amount of throughput and the number of people that may be coming in. But for sure, there will be sites in I cannot tell you when it is going to open up. But there will be for sure sites in vaccination sites in your neighborhood.
Because I tell you what concerns me, and I've been over to the Highbridge Recreation Center a couple of times in the last couple of weeks, which is now one of the testing sites, and the lines there are very long. And I don't know how many hours people are standing online waiting just to be tested. I can only imagine how long the lines might be when the vaccine finally becomes available. So, I think we're going to need a fair number of sites in the community, and I'm hoping that we can that will include the medical center and the NYEP as well. That they will also be vaccinating people, not just their employees.
The Armory.
Yeah, I cannot speak to the very specific space, but I think what the OHMH will be looking to do is really to partner in being able, whether the OHMH may have any space, and of course there's a clinic on 168th and Broadway, so that may be a potential site, but also to leverage partners, such as NYP, as well as other facilities. There are some FQHCs in the area that will be able to provide sites as well. And of course, being able to what we call a pods, point of dispensing, where we may stand up a specific site. Again, I don't want to speak too much about that because I do not know where and when, but if there, I guess I'll say this, Pauline and I will definitely take suggestions and bring it back to some of the decision makers within the OHMH, and we'll see where, and also, of course, suggestions from the elected officials.
Well, whoever just suggested the Armory at 168th and Fort Washington Avenue, that's a very good suggestion, because there's I don't know that the track is being used at this point, but regardless, I'm sure there's space there that could be utilized, and that we should take a look at that. And in case the medical center says they don't have space, they're right across the street. Maybe they can utilize the Armory. Who suggested that?
That was me, Stu.
Darryl.
Oh, Darryl, very good.
I think it's also
Have
key.
you also looked at mobile? Have you also?
I'm sorry. Let me go back to the to my list here. Tanya, are you still you have a question?
Yes, I just want to let you know you got a couple people, got Mary and then Sally, but and then we got some questions from in the Q&A, and whenever you're ready for that.
Well, I saw a couple of questions from Cheryl Miller and Maggie Clark.
Yeah, there are a few. But yeah, I have a question, Pat Moore. The first question I have is, how will the underlying health conditions be defined? Like, what are we going to mean when we get to the category of people with underlying health conditions? Like, what categories will that include? And then the second question I have is, how is the type of the vaccine received determined? Like, do you request one, or do your doctor make that determination? Is it Moderna or the Pfizer? Like, how is that determined? Yes.
Both very good questions, Tanya.
Yeah, very good questions. One second though. I just realized something, Padmore. I did not properly introduce you. I did not recognize the fact that you're a former chair of Community Board 9. So you have some bona fides about dealing with.
I was going to cheer you on, Padmore. I said, Steve, you're forgetting.
Thank you, Sandra. Good to see you, by the way. Happy New Year.
Happy New Year.
Thanks, Steve. Thanks for letting that out of the bag.
Okay. All right. Back to Tanya's questions.
Yeah, and as I said, they were good questions. So it's really the state that is going to be determining that in terms of what those underlying conditions are. But some of the things that we have seen was folks that may have had heart disease, obesity, diabetes, some of this type of stuff. When they did get COVID, they were being a little bit more impacted by someone who didn't have that. So in terms of whether obesity is going to be high or diabetes or heart disease, I do not know. It's going to be coming down to the state. But we definitely will be, having that conversation. DOHMH will be having that conversation with the state, and of course, being able to make sure that regardless of that, we are able to vaccinate as many as people as possible that have some of these underlying conditions. And then in terms of making a decision in terms of Pfizer versus Moderna, there's a couple of things. One, if you're going to and I'm not putting you on the spot or anything, Sandra, but if you're going to a place like NYP, which has the capacity and the facility to have both of the vaccines, the Pfizer requires very, very low temperature. And it's not all facilities or all places that can provide the vaccine has the capacity to do that. So if you're going to a small FQHC, or they may not be able to have the capacity of the facility, the equipment to store the Pfizer, so they may just have Moderna, right?
Okay, one second there. We don't all know that FQHC stands for Federally Qualified Health Center, yes. And we have one at 145th in Amsterdam. I'm not sure whether we have any in.
We also have the Ryan Center, Steve, that opened.
Of course. Oh, yes. We now have the Ryan Center at 181st and Wadsworth.
Yes. Yeah.
Yeah, very good.
Yeah, and some of these we also there's going to be also be provided by your private providers. So a lot of the small pop-up doctors that are located in Washington Heights and Inwood, they'll be able to get some as well. But again, it's according to the capacity. So according to where you're going and the capacity of the facility that you have, they'll be able to either have both, and it's up to you the decision you want in terms of which. But sometimes, according to where you go, you may not necessarily have an option. You just have to take which one is available at that facility.
But we got to get the word out to these doctors so they know how they can obtain the vaccines. I mean, it's
right.
it's not like it's just going to come in the mail. They're going to have to request it.
Yes, but the Department of Health has been putting a lot of information out to providers right now to give them notice about the vaccine, how they may be able to get the facilities ready to accommodate. So that's happening right now. All vaccines that are distributed go through what we call the CIR, which is a large registry that all providers must report through back to the Department of Health. So that is already in place, for all the other vaccines that doctors are currently giving out, right? So we've already established a relationship, flu vaccine, any other vaccine that anyone may need. So a lot of that is going on right now, and we have been passing on information via that system. But the Department of Health is making every effort to ensure that all local providers do know how to get it, how to store it, where they can access it, and how to distribute it.
All right, very good. Mary Anderson. Mary?
Yes, here I am. Question I have is there any recommendation for someone who has no symptoms but is curious about the status for COVID, because people are out in the community, going to the grocery store, going to the bank, going to necessary places? Any recommendation as to how often one should be tested or could be tested?
That's a really good point. I know Laureen loved that question. Laureen,
yeah, can you hear me now?
Yes, we can.
Yes. Sorry, I've been having crazy audio issues. Happy New Year, everyone. So I love this question. We are now asking folks to please get tested monthly. And if you're in populations like myself doing outreach as often as I am almost daily now. I get tested twice a week, but folks usually get tested once a week or bi-weekly. So if you're an essential worker, we're asking you to do it, or frontline worker, at least bi-weekly. But you can take, every 4 days a COVID test. But for regular citizens who aren't out as often, definitely monthly.
Thank you.
Very good.
I was beginning to think I had some OCD about this, but I appreciate that.
Okay, Natalie Espino.
Hello, Health and Environment Committee.
Excuse me?
Hello, Health and Environment.
Hello, yes, yeah. Well, listen, I heard you speak at the Parks Committee meeting a few weeks ago, and you told them that the Parks Committee is your favorite committee. So,
Well, I
Don't
will.
be jelly.
Don't hate Steve. Don't hate Steve. That was my original committee on this board. So I am loyal to them. But I am always in awe of the work done by this committee and their recurring guest stars who joined the call. So I just wanted to, you had brought up the rates in Washington Heights, Inwood, which of course we are always very alarmed at. And we all know that a big part of this is behavior, and it's behavior everywhere. It's not just in our neighborhood. So there are the behavior things, but I think that there are other factors that are putting us more into that high rate. I think Sally and others on this committee have pointed out before that we have a higher percentage of essential workers in our population. I will just put out there again what many of us know, but maybe forget, that a significant number of the people in our community live in tightly packed, multi-generational small apartments. So that is something that's not in their control. That's not a behavior issue. And it is all the more reason why proper safety behavior and access to the information is so crucial up here. So I'm just wondering, since I know that this is a state decision on who is going to be added to these yet to be determined priority categories, but maybe those of you on this call who are in those conversations with important folks who make those decisions, if that can be something that can, be added to the conversation. Is there a way that people who are living 8 people in a 2-bedroom could find some way to get themselves higher on the list? And on the bright side, when they do get vaccinated, there is not an issue at all about someone observing them for side effects.
That's an excellent point. Thank you, Natalie.
Yeah, thanks, Natalie. I don't want to make the association that everyone who's living in a tightly packed apartment falls into the group of essential workers. Those are 2 distinct.
Yes, it's a different category, but it's
and the essential workers are already being folded into these different phases.
Yeah, but
they're very easy to identify.
Yeah, it's a very valid point you raise, and thank you.
All right, so we'll keep an eye on that, because I think she raises a very good issue, and I think that is clearly a factor in why our positivity rates may be higher than other places in Manhattan. Sally, did you have another question?
Yeah, and I had a couple comments. One of the things that came up with the rapidity of the getting from trials to a vaccination, it came up on the panel that Gail did recently, sponsored by the community boards, some of which showed up. Anyway, what they said also, the point to make in this one, people are looking at other vaccinations and the time frame. And one of the things to emphasize on this is the phases of the trial were run concurrently. So it wasn't waiting for the result and then going to the next phase. They were being run concurrently. So that also helped with, and I think that kind of information makes you a little calmer about about why it was so fast. The second thing is, have y'all considered mobile vaccination units where you would just take a truck to a known hotspot area and park it there? I mean, that seems like it would be possible with the Moderna vaccination only requiring refrigeration. So it's just a matter of someone who can man it and getting the vans.
Yeah, I cannot speak specifically to that plan, but I know that there's a lot of different considerations that are being put on the table at the moment. One, we want it to be safe, we want it to be effective, we want it to ensure that it is capable of meeting people where they are in certain instances. One of the key populations that's going to be starting up relatively soon are the 75 and over. And obviously, it's very difficult for some individuals in that age group to come to a facility. So we are going to be trying to be as creative as possible to ensure that we're able to meet people where they are, and that's part of the equity that we are trying to ground everything that we're doing in that. But I cannot speak to very specific. I don't know, Pauline, if you may have more information, but we are looking to be able to ensure that we are meeting people in their spaces where they are.
And also, I thought that was a great presentation. I think you should do a column in the Manhattan Times, just explaining these facts. You could do like a weekly or bi-weekly. They also have ad space, but I think the information that you're putting out there, people need to read, and they read it in Harlem, they read it in Northern Manhattan.
Thank you. Yeah, Pauline can speak to a little bit more of the press that we're going to be engaging in terms of making sure it's being as widespread as possible.
And you could write articles like you don't have enough to do.
But before we lose this point, though, I think the Ryan Health Center and I think New York Presbyterian and others have mobile vans, and I think as Joel Rothschild points out in the Q&A, the mobile vans would be very useful in reaching various populations, and I think you just Pat Moore also agreed with that point, and.
I just want to cite Steve with that, the importance of engagement and educating the community around that, because remember, it's 2 doses. So you want to make sure that people are going to the vaccine in clinics or in medical providers where they have a relationship with for that follow-up visit, right? We can be contacted. So that needs to be well coordinated if we choose to do outreach, mobile vaccinations.
Well, couldn't you schedule the mobile van so that they're at Broadway and 157th Street on one day, and they return 21 days or 28 days later, if necessary? You give people an appointment card, tell them we'll be back here when you need the second dose.
I think all of these are being put into consideration right now. I think it's for most likely when the vaccine is readily available to all New Yorkers. I mean, at this point, again, we are, waiting for the state to be able to tell us who's eligible and where folks can receive the vaccine now are, at very specific locations. So I think, yes, as the vaccine becomes more readily available, we will be looking into, what makes the most sense for certain communities and for certain, for folks that may have access issues. And so that's definitely something that is being discussed now. I think what I can do is go back to our vaccination team to see if they have come up with certain criteria that they're looking for a local dispensation site or for a location for a mobile site, to see if they have anything in writing or if they're coming up with sort of a checklist. That way we can present that to the community and you would be able to share with us where you think would be an appropriate location.
One thing I want to add to the list, just so we don't forget it, is the Dyckman houses. You could actually set up, and they have the day when they're handing out, where there's a huge line where they're handing out food and that kind of stuff. I remember when I was a kid standing in line for the sugar pill with the polio vaccine on it. And those were just in schoolyards. I mean, it's obviously it's a lot easier to control things when, it's a sugar pill, but or sugar cube.
You're dating yourself, Sal.
I know, I'm really old.
Right.
I'm really old. I'm getting older every minute.
All right, can Cheryl Miller ask her a question? She has a question about metrics. She wanted to know why the state and the city use different metrics.
Because we have two people that can't get along.
But I don't know, but Paola, can Cheryl Miller talk?
One second. Yes. Oh, she has to
Hi.
unmute herself.
Hi, can everybody hear me? Can you hear me?
Are you Cheryl Miller?
Yes, I am.
Go ahead.
Hi, everybody. Okay, so I had like a question and a comment. And one, I'm like really angry about this. What I'm hearing is that the state is, prioritizing the groups. So group 1B, which is the next group that's going to be prioritized, is going to consist of people 75 and over and essential workers, some essential workers. I'm 66 years old and I have several underlying health conditions, one of which is asthma and chronic obstructive pulmonary disease, which, it's a known fact that COVID does attack the lungs and destroys the lungs. So I've been socially isolating since, feels like forever right now, and only going out when I have to. But the thing is that I do not understand why group 64, my group 65 to 74 is supposed to be group 1C. And that's not going to be till March or April is what the state is projecting. And what I don't understand is at the very beginning, they said, oh, people 65 and over are the most vulnerable, and that's who's going to get the vaccine. So now when I don't know how all of that changed now, that 75 and over, and even the mayor was saying today, we got to get people 75 and over vaccinated. We got to get them vaccinated, because they're at more of a risk. So are people 65 and over that got underlying health conditions. Okay, that's one thing. But then I don't understand with the metrics that the state uses for the infection rate. I mean, when the governor gives his news briefings, he's saying Manhattan is like 3%. How could that be when Washington Heights is like 8-9% by itself? And Inwood. And I don't understand. And then when the mayor gives the metrics, the city, it's a whole different number. So I don't understand like how is the state's numbers lower than the city? To me, that just makes no sense to me, but I am not, I'm not the one that's doing the calculating, but I was just wondering if you can possibly answer that.
Yeah. I'll start with the first point you raised in terms of the 75 and the 65 plus. Part of the reason, and part of the reason not being able to get to the 65 plus, not that there's any justification, is just the limited number of vaccines that we have at the moment. So, and some of that is projection in terms of saying when the 65 plus might be able to get vaccinated for the vaccination. Well, we know one of the newer vaccines may come online. We may be able to access it much faster. Distribution that may be able to be ramped up and increased. So from what the way the state has been doing, and I don't want to say anything about the way the state is doing the stuff, but there's a certain amount of vaccines that are available. There's a certain amount of individuals that are in a particular population based and that are prioritized, and you're going to go down after everyone in that first priority is vaccinated. And so you can project, well, based on the numbers that we have, we only have 400,000 vaccines. We have to inoculate 600,000. We don't even have the capacity for the current demand. So it's going to take time. So it's as much as we would like it to be, very specific and as quickly as possible. Unfortunately, part of the problem is really just the capacity to meet demand that is out there. The other thing, I'm not too sure, and I'll ask Pauline to jump in on this, but I know I'm not sure, I can't speak very specific to those numbers. I don't know whether the governor was saying in general, and the mayor may be specifically speaking about very specific locations within Manhattan. But we do know that the Department of Health is going by its own reckoning, and that's probably the numbers that the mayor is using. And we're are very specific by zip code to be able to give the percent positivities for those areas. Pauline?
Yeah, I can reach out to our data team just to see how they break down the information, but I know that we utilize a lot of times information by, 100,000 people. But also I think just percentage wise that when we are talking about positivity rates per zip code, it's based on the population of that zip code. And so Washington Heights can have a higher percentage of positivity, whereas the rest of all of Manhattan can have a lower number because of just how many people are being tested, and each zip code has a different positivity rate. And so that's probably why you're seeing a little bit of a difference, that even though Washington Heights might have a higher positivity rate, averaging out all of the other zip codes in Manhattan can bring down Manhattan's total positivity rate, so that there might look like there's a discrepancy there, but it's because we're taking the whole population into account. We don't really know the state's data points. I believe we have asked some time ago and often whether or not they can share that with us, and I don't know whether or not they have at this point, but I can circle back with our data team to see sort of what their metrics are being used by the state.
Okay, thank you very much. Thank you.
Pauline, are you saying that I'm confused now. Are you saying that the positivity rate is based on the population in each zip code as opposed to the actual numbers of people who have been tested?
So there's the rate and then there's the actual number. So the rate is correlated to 100,000 people. And then there's the actual number of how many people are getting tested and then how many people are testing positive. So there are a few different ways to calculate our percentages. So you have to read the fine print and download the data table so that you really get to know exactly what that number is. So yeah, data is collected in so many ways, and sometimes it gets really confusing if it's not clear exactly how it's being compiled. But yeah, so there's a real number and then there is a number per 100,000, if that makes sense. So I will have to.
No, I've seen those numbers. Okay, I got to reread the fine print. But I've been assuming that when we say that the positivity rate for zip code 33 is 9.31%, that it was 9.31% of those people who were tested during that 1 week period. So maybe that's not the case. If it's actually 9.31% of 100,000 people, that sounds much worse.
No, it's rated again. So I will get the information from our data team as to how exactly we should look at this data. But yes, it does get very confusing. And I feel like on our website, it should be a little bit more clear as to how people calculate things. But let me just get back to you exactly on how we calculate our numbers and our rates.
All right, very good.
Holly, can I ask one other data question? Are we any closer to finding hospital-specific data? It looks like the American Hospital Association had some pretty powerful lobbyists working on their behalf in Albany. I think they should be, they have the same data that nursing homes are submitting. It's just nursing homes haven't been as successful in keeping that information from public view. And we really need the data. I know it's not a city level, the data provided, but I don't know how to interact with the state to get them to disregard the contributions from American Hospital Association.
Yeah, I definitely brought this forward to our emergency command structure, and unfortunately, I didn't really get very far in terms of how we can compel hospitals to provide that data. I don't think that that's something we can do. So I am happy to see if we can find a contact for you at the state.
That would be great. That would be sympathetic, someone who loves information and is as frustrated as we are that we can't get it.
Sure,
but
understood.
DOH is publishing data broken down by borough on hospitalization rates. So somehow you're getting the information about the number of cases in the hospitals, or else you wouldn't be able to publish the data on your website.
Right, but wasn't Ms. Fisher asking for very specific data about deaths in hospitals?
Well, I just wanted anything on a hospital specific level that we can get, admissions, lengths of stay, death rates, et cetera. I mean, they're providing.
Yeah, I mean, I think, so we get this hospitalization data from the state. So, which is why there's always a lag in information from when we post and when the state has data on their website. And so a lot of the information we receive, including confirmed deaths, is also from the state. So again, I think, you know, I would probably, it would probably help to find you a contact at the state level to be able to answer your question more clearly.
Could you also forward a copy of the hospital specific data that they sent to you? One of the emails?
Oh, I'm not sure if that's something that we're allowed to share.
Is that, but apparently, am I hearing that in that data, you're getting rates by hospital? You are getting some information by hospital, it's just not making it up onto the website?
I don't know.
Okay.
We get information about hospitalization, you know, people who are admitted into the hospital, and additional information from the state. It has to be verified by the state, and then we get it. But I don't know whether or not that information is something that is allowed to be, you know, widely distributed among the public. So I'm happy to ask, but I don't know.
If we could touch base offline about this, that would be very helpful.
Sure. I mean, it's held by the state, the information. So I will definitely think that the most appropriate person to be able to answer your question would be someone who works for the state health department.
Right,
Well,
he's preparing those reports.
Okay, let me just clarify that we're not necessarily interested in the number of deaths.
Yeah,
Although
Right,
that would
it's
be-
just all hospitalization data. I got it.
Whatever is on a hospital specific basis.
Mhm.
You have to, you know, rather than the activated data, 'cause I even get frustrated on y'all's site trying to drill down. Like I will see a very interesting thing that I would love to drill down further. And I think I'm just not, either it's not available or I'm just as bad at technology as everyone tells me I am.
Okay, Maggie Clark has a question about whether DOH is, I think is interfacing with DEP, which is testing wastewater to determine a possible virus, the COVID virus cases. Can Maggie Clark speak? Is Maggie Clark muted? What?
Hi, I'm here.
Go ahead.
Okay. So I'm on the Manhattan Solid Waste Advisory Board, head of the Long Range Planning Committee, and we've looked into the method of testing wastewater for SARS-CoV-2, and it's been used all over the world since March. And the purpose of it is it's an early warning system. It's a much better metric than hospitalizations and deaths and beds, which are all lagging indicators. It's really important to be able to test the wastewater because that gets everybody in the waste shed immediately, even if they are asymptomatic. So, you know, and we know we've been asking and pressuring, and the borough president has been sending letters about this as well. Who knew she was a wastewater geek, but she is. You know, to DEP, and they have been doing some testing, but they haven't made any of their data public. Meanwhile, I've been tracking Boston. The BioBot has been measuring them ever since March. You can see the graphs just like you could see Cuomo's graphs that he puts up every day. And you can see the spike that happened right around Thanksgiving, which is like twice the size of what was happening in March. And the spike happens earlier in the wastewater testing than it does, if you're looking at hospitalizations, for example. So it's more useful in determining, oh, we've got a spike coming here, we better shut something down. So, is DOH looking at this data? Can we see it? Can it be made public, please?
Well, let me first ask you, do you know whether DEP is doing this testing at the North River plant at 145th Street?
My understanding is they're doing it at all of the wastewater treatment plants.
And Maggie, can I ask you a question? What, geographically speaking, what are the parameters? How exact can you get in parameters of a neighborhood?
Yeah, you can, if there's a manhole cover, you can get a probe down into the manhole cover. You can,
Which covers what? I'm sorry, which covers what? Like that one block?
Well, you could actually put it in the effluent from a nursing home if you wanted to. And I think that is something that should be measured every single day. Because as soon as, you get a positivity, then you know that everybody in the place needs to be tested individually. But this method of testing, where you don't know who's being tested in terms of, it's a small percentage of the public, and it changes every week. And it's delayed because people don't even go to get testing typically until they have some symptoms, which can be anywhere up to 14 days after they get it. So it's much better to be testing wastewater, which gets all the asymptomatic and symptomatic people in one fell swoop.
Yeah, but if you're doing it at a sewage plant, the sewage plant takes in a huge catchment area.
It does. It's a different purpose when you do it in the sewage treatment plant, because there, you can see big changes that are happening. Like if we've just had Christmas and New Year's, and if all of the sewage treatment plants are starting to spike, that's one thing. But let's suppose it's just one or two or three, then you know that there are localized issues. And things can be done to then further try and narrow down what's going on. But as we know, the current testing scheme is lagging indicators. It takes time for people to recognize that they should get tested. They go get tested. It takes days to get the test back. There are delays. Columbia University, by the way, is testing not only their own campus, but Bergen County. I saw this on the news a month ago or more, and they were saying that there's a 2-week lag from the time of the wastewater testing to the other kinds of metrics that are being used, the lagging indicators. This is well known in a lot of places. Syracuse University's been testing for many months, and New York.
I can see how it might work in smaller places. I can't imagine how useful it is if you're testing at the North River sewage treatment plant, which it takes in most of Manhattan.
Well, let me give you an example. We're making these decisions like schools should entirely open or schools should entirely close. And if you have, instantaneous information all over the city, by virtue of these 12 or 14 sewage treatment plants, then you have a good idea, on a day-to-day time period as to whether there's spiking going on or, we're just about to enter a bad period.
All right. Well, Pauline or Padmore, do you have something you can? Are you familiar with this question?
I believe DEP was conducting some type of study of wastewater and COVID-19 potentially, but I don't know specifically how that would tie into the Department of Health's work and whether or not we've been looped in on any findings as of yet. I don't even know if they have any findings. So what I can do is I can circle back with our water team just to see if they've been in communication with DEP and follow up with you guys.
All right, thank
Can
you.
we,
Sure.
can we get the data, please? Can it
Well,
be made?
I don't know if there is any data available as of yet, and then whether or not that can be shared. It might not be something that DEP would be. I just don't know. So I'm happy to ask.
All right, and we can make separate inquiries to our contacts at DEP as well. All right,
And
thank you.
can I just ask Maggie another question?
Yeah.
Thank you. What is like the staffing power needed for something like this? Like, I mean, you talked about maybe specific manholes. Is that like something that a staff person would need to go and do each time, or can something be placed down there and left and monitored remotely?
No, it's a grab sample, so it doesn't take, any time to grab the sample. It's not like you have to sit there, to monitor something.
But a person has to do it.
Yes,
Device.
you'd have a person doing it. This is the monitoring of wastewater for, biological, bacteriological stuff has been going on for a long time. It's not new. That's why when I first got wind of it, the Netherlands and Paris, they were doing it in February and March because they already knew how to do this, and they thought, oh, we better see. And in the Netherlands, they started doing it early, and they had 0000 something. Here it is. It arrived.
All right, and Natalie, could you also find out
Steve?
for us?
Yeah, Steve, I'd like to make the comment.
Barbara, hold on a moment. Natalie, could you find out for us whether Gail got responses from DEP on the letters that she sent?
I will find out.
Actually, I'd like to see the letters, so maybe you could also have them forwarded to me. Barbara, you have a question?
Yeah, I wanted to make, Maggie, I have the floor. I wanted to make the comment that on a community board level, a judicious selecting of sites where there could be a concentration of population and a concentration of vulnerability could be very useful. Right now, when kids are in school, they're spot testing some kids every 5 days. Instead, if you were testing wastewater, for example, let's say at the top of the hill where Isabella and George Washington High School are, and a couple of those elementary schools, if you were testing, like as she said, a manhole or an effluent place where those wastewaters converge, if they do, you would be all of a sudden testing a couple thousand people at once. And that would be a very good detective thing to do. And then that can set off an early alarm. So I think it could be at certain nodal points, an extremely judicious way of doing a preliminary mass testing.
Maybe yes, Community Board 12 could request testing at Isabella, for example.
Like the wastewater discharge from Isabella, and also where, like, if GW High School is in any kind of session, if it were to open up, where did Isabella, and then that school at about 185th, that's along Audubon Avenue by the park, and so forth, where do they kind of intersect, right? And that's a way to very early on find out, right?
I don't know. I'd like to hear more from DEP on how this thing would work. So
I'm suggesting let's find out.
Yeah,
right?
Okay, let's find out. Bernard Grobman has a question or a comment.
Yeah, I have a question for the.
I'm sorry.
Yeah, I have a question.
Yeah, go ahead.
Okay, so it's about prioritization of vaccine. Actually, I found out some surprising information. I didn't realize that Florida now has a larger population than New York State. But,
they're gonna end up with more members of Congress than we are.
I know. So they have 21 million people. We have 19 million. They're right now vaccinating people over 65. Right now. What they're doing is they have prioritization, and then whatever's left over, they're using to just get people over 65, because that is a vulnerable population. Now, of course, they probably have more people over 65 than we do. I'm pretty sure, because it is Florida, and that's where you go when you're over 65. So the question is, why aren't they doing it here? I mean, they're already vaccinating people who are over 65. I'm sure they have the same exact CDC guidelines that we have.
Yeah, well, maybe the federal government has given them a larger allotment of vaccine.
I would have to look up.
Yeah, well, consider who's making the decisions on how the vaccine is distributed.
Well,
Where is
that's true too. Yeah,
Where is this?
Florida.
Well, you have such a concentration of senior citizens that the spread could be much more dangerous, much more virulent.
I mean, I'm sure we have an awful lot of senior citizens here, but
I wouldn't assume that that every state is getting at this point. Maybe it's a fair share of the vaccines.
How many doses has New York State gotten so far? I think you had a number, right?
Wasn't it somewhere around 400,000 or 500,000? But
430,000.
what was your number?
Yeah, but that's just for New York City.
That's just New York City.
Oh.
So you don't know the state total, right?
Not offhand. I would
Okay.
assume it's probably on their website. I'll have to check, but I can definitely get back to you.
Well, I don't have that number, but I was just wondering about that because I saw the prioritization for New York State, and it has basically people in facilities, right, or something like that. Next, is that what's next up?
Probably long-term care facilities.
Yeah, right, long-term care facilities, and
the workers.
I thought 65 was 1B, but
yeah, well, apparently that is the case.
And I mean, I also just some of the guidance. I don't want to speak out of turn, but some of the guidance are changing according to capacity. It's according to also. There may be a lot more healthcare workers that are saying yes in New York State than that are saying yes in Florida. So more is going to be going to that population. So it's a variety of things. But I think what everyone is recognizing that, one, do not waste any of the vaccines if a population is saying they don't want to take it. And I think there's a pretty large, not a large, but I think 15 to 20% population of some of the healthcare workers that are saying they don't want to take it at the moment. So it's being diverted to other populations. And as if that vaccine capacity is going to be decreased, it's not going to go to waste, it's going to be utilized in some way, and hopefully we'll be able to get to other populations. But yes, we're going to try as quickly as possible to get to 65 and over. But unfortunately, there's a few other priority populations before that.
Okay, well, I tell you, we're running way behind, so let's see if we can move on. Padmore, thank you very much.
Jay had his hand up. I don't know if you want to take it.
So thank you. Jay, you have a question? Jay?
Hello?
Yeah, Mr. Meza, go ahead.
Yeah. On the Brian Lehrer show today, Mark Levine was complaining about the method that the city was using. First of all, the amount of shots, and second of all, that shots weren't being given out that were left over at the end of the day to other people like 75 and older. And his concern was based on the high morbidity and mortality rate of over 75s. I was wondering how the city plans to address this problem.
Okay, that's a question for, I guess, Pauline and Padmore.
Yeah, I didn't hear the comments, so I cannot really speak towards it. But I know for sure that we are trying to maximize the amount of doses that are available to go to everyone, so none is being wasted. But yeah, I'm sure that I know for example, but the way the vaccinations are going right now, you have to go on an appointment and schedule it. So there's an idea of the number of expected individuals that are supposed to come through at a certain period of time. And again, once the vaccines are opened up, you want to make sure that every single dose of that vaccine is opened up, is utilized. So part of that is if everyone comes that are supposed to come, we're able to adequately utilize the vaccines. If for some reason that others are not, that's when you may be able to have take it on to a different population. But I'm not too sure exactly what was
the councilman's understanding that they are not given to other populations, and his other complaint was based on the fact of only 52,000 people being injected in a week.
Well, yeah, I can speak to the fact that the city is really ramping up at the moment. It's really ramping up. Obviously, it's going to take some time to be able to allocate space, allocate the distribution, identify staff and capacity. We want it to be as safe and as effective as possible. But I can tell you that it's really ramping up. Yeah, I'm not sure if there's anything more Pauline might want to add to that. Okay, so thank you, Steve.
All right, thank you, Padmore. And I think we'll be seeing a lot more of you, right?
Yes, that's true. That's right.
Okay. All right. Very good. And you'll remember to send me the presentation.
Yes, I will.
All right. Thank you very much. Thank you, Pauline. Lorraine, do you have more stuff to add?
Well, Steve, I just sent you prior to this meeting, or actually at 7 o'clock, our T2 outreach Manhattan updates presentation, along with our strategic plan that's added into that COVID PowerPoint presentation that you can circulate to folks, our updated Manhattan flyer for our testing sites this week, as well as our Take Care, which is our resource navigation sheet that could be circulated in the newsletter and given to folks so that folks know how to access resources such as our free hotels and our 212 COVID-19 hotline, how to use that, how to utilize it better.
Okay, well, one reason I was a little bit late to this meeting was because I saw that email and immediately forwarded it to all of our committee members and to the community board office. So I will encourage, actually, let me double check on that. If I didn't send it to you, Paola, I'll send it to you after the meeting, and hopefully you can send the material out to our entire list.
Thank you. And also, if folks know of any upcoming events for the month of January, please let me know. I do have already quite a lot of events coming up already planned for the month of January, but we are willing, and if we can accommodate any other events where we know that there's going to be a lot of folks that we can engage folks for outreach. We now have hand sanitizer. So Steve, I'll email you on the side to see if we can do a delivery to CB12 so we can use it as a point of distribution for folks, possibly for future action days, along with masks.
This is Di. I just wanted to add to that we are doing a special push for Martin Luther King Day. So if there is any events that CB12 or any of the local elected officials will be doing around Martin Luther King Day, we will be available to partner with you. Our ask for that quote unquote week of service is any partnerships with local community groups, nonprofits, CBOs, and faith-based organizations. With a specific ask that we would like to empower our neighbors to be able to be ambassadors for us. So for example, we will have PPE, hand sanitizers, flyers, and other information that people can just email us and we can arrange either drop off or pick up opportunities for those who feel capable to do so safely and socially distanced, in a socially distanced manner, of course, fully masked. If someone wants to pick up, 100 or 200 masks and flyers to give out in their local residence, in their NYCHA housing, if they're a parent that's still taking their kid to school and wants to maybe stand outside of school or share it with their PTA, if someone is still commuting to work and wants to maybe come a half an hour earlier to their local train station to give out to neighbors who may also be commuting, if someone wants to partner with the local restaurant and include items in deliveries or work with restaurant workers to do distribution, lots of great ideas and ways that we can be of service to our own communities, empower our neighbors to help be ambassadors, to make sure that we get everyone masked, that everyone has hand sanitizer, and that everyone has access to all of the services available for free through the city, including whether it's, a listing of mobile testing units and flyering your building and or being able to disseminate information about, the free hotel, free food delivery, and free medicine delivery for those who may test positive.
Very good. Who was that just now?
That was Nye Whitaker.
It's
Oh.
Nye Whitaker. Hello. Your fellow community board member from over at 11 who's working with Test and Trace.
Well, good. You crashed our meeting again. Okay, very good.
Hey, Steve.
Mr. Cochran.
Yes, hi. And sorry I was late. I emailed you. I was at Newark just like 2 hours ago, airport. But I wanted to ask, and Lorraine, I'm sorry, I don't want to put you on the spot, but I just want to mention about a testing experience that I had, if you don't mind. And basically it was at George Washington High School campus. Myself and my roommate went, and we never got the results.
What?
And I won't even go into the professionalism or lack thereof of some of the staff that were there and how differently we were treated. But
who runs that site?
Well, it was I learned later it was called Somos.
Oh.
I don't know if they're doing any of the testing currently in our neighborhood. I know Lorraine, like we talked it out. I mean, you were wonderful to talk to me many times about it. We still never got to the bottom of it. And I never got my results from that visit. But, I know others had that experience, not just me and my roommate, a coworker who lives in the neighborhood had a similar experience. And I just don't want that to happen to people again.
What location did you say? I'm sorry.
This was at George Washington High School. It's so long ago, I don't remember. It was like late November.
Yeah, you guys did a pop-up weekend site there. Remember, Lorraine?
Oh no, I know.
Oh no, we talked about it.
Oh yeah,
no.
we know Natalie. David Cochran.
He's been very helpful at trying to navigate.
He's been on a few conversations. I definitely highlighted this to our testing team and escalated up to the executive staff about this particular contract that we had with this facility that was doing the testing, because that brought up major concerns. I knew that if it happened to Mr. Cochran and his roommate, that it was possibly something that could happen or was already happening to folks in the community. So we're definitely trying to rectify and make sure that that never happens again.
I don't know if they're already contracted to do other pop-ups, but
yeah.
Obviously,
is it almost doing testing at its own facility on Amsterdam and maybe 177th Street or something?
They are, and they're also doing it at St. Elizabeth Church and a few other locations.
Yeah.
Sorry, I just asked because I think I also heard a concern on something on 180 somewhat or another in November that people didn't get the results till way later.
Oh.
So yeah, I'm sorry, and I'll try to figure that out and let you know, Lorraine.
Okay.
Trying to jog my memory. Thank you, Daryl. I'm sorry for interrupting.
No. Thank you, and thanks again, Lorraine.
Was that Marielle?
Yes, I'm here.
Oh, very good. Okay. All right. So Lorraine, we have your report, do we not? You just gave it?
Yep, that was my report.
Very good. Okay, thank you for joining us once again. Julio, are you with us?
I'm still here, yes.
Okay, all right, it's your turn.
Sure. So thank you. First of all, happy New Year and healthy one to everyone on the call. Just to let you know, as of this morning, we at the hospital, New York Presbyterian, had 110 COVID patient cases around throughout our healthcare system. 163 of them were in the intensive care unit in the ICU. Like other hospitals, as I mentioned last time, there's still an increase of inpatients across all our campuses. However, the numbers do remain far less than what we saw last year, earlier last year. We anticipate these numbers, of course, may go up, but we are hopeful that as we get further away from the Christmas holidays and New Year's celebrations, that these numbers hopefully will start, leveling off. That is a hope. We remain, again, confident on the amount of PPEs and the quantities of PPEs and other supplies to sort of meet the demand as we go forward. As folks talked in this, earlier, the bright spot happens to be that, we do have the vaccine. Those vaccines have already started to roll out. We now have the Moderna vaccine as well, which was approved. So, and it's a good thing. In terms of, the hospital, we did have gotten a supply, and we were cited by the governor as being one of the leading institutions that have vaccinated at least 99% of, or used 99% of the vaccines that were issued. And of course, as those were for our frontline staff and people who are dealing with patients every day. We are still waiting for, guidelines from the state and hopefully, start beginning to vaccinate the community. Hopefully that will start early, of course, in 2021. Unfortunately, we don't have the sort of timeline for that as well. We are hoping, however, that based on our record of, using, basically the majority of all the vaccines that were issued, that we would also likewise be given the liberty to start vaccinating our patients when that moment comes. I'm not sure how that will be rolled out by the state, but we're hoping that they would take that into consideration and really allow us to, to vaccinate our patients. One of the other things is that's of concern, of course, and we've spoken about this in the past, has been the vaccine hesitancy, which is an issue that that we will know will come up, and certainly we would like to work with the city and state on public education. I know that Mary from the aging committee has also expressed an interest in certainly trying to work with everyone so that we can get the word out and make sure that our vulnerable population does get vaccinated as time comes. The other thing I'd just like to say is really, encouraging everyone to practice the 3 W's, which is wash your hands, wear a mask, and of course, watch your distance from other folks. And obviously, the other thing that we can do to help alleviate the situation and that is really still to get your flu shot. It's still not too late to in essence to be able to do that. So still encourage everyone to get the flu shots. Finally, I just want to end that my report by also reporting out that when we recognize that our focus remains on this deadly disease, there is a lot of other major community needs out there, and so I'd like to also report that our nursing team this year has again initiated a code drive, distributing codes, nearly 500 of them, to our local community, distributed to local community groups. So we work with the Dominican Women's Development Center, the men's shelter at 168th Street, and also the Washington Heights Corner Project, which got a bulk of these codes for their population and their clients. So I know that, I think I saw Sandra on the call as well. And I'll leave her to speak a little bit more about some of those other needs that we're hoping to meet, especially through the Medical Center Neighborhood Fund, which has done a lot of work. And, again, commend the university and Sandra and Ross for really, playing a major role in getting our folks to contribute and support our local community. In terms, I know you had some concerns about, capacity. Our capacity, we talked about this earlier on with the committee. We do have, as the governor had wanted, for us to look at, building capacity, and, we do have the spaces that we sort of converted at a great expense during the initial phase of the pandemic. We still have the hospital, the field hospital up at the Bakersfield, which is there and ready to go if need be. Hopefully we won't need it, but we do have that prepared in case that we do get a surge all of a sudden. But our expectation and hope is that we don't go back to April and March and April where we had so many people who can really accommodate. But so we're hoping that things will sort of settle down as the months go by and people get vaccinated.
Julio, what was the first number that you gave us on the number of COVID patients throughout your system?
Well, the number of patients are 810.
810.
Yeah, 810 with 163 in the ICU.
Okay. All right. So, for the record, once again, I have to ask and reiterate that the numbers that we're particularly interested in are the 3 facilities in Washington Heights and Inwood. And your system obviously includes other boroughs and and goes beyond New York City. So and our focus remains the 3 facilities within Washington Heights and Inwood. I appreciate getting these numbers, but it would be greater. It would be much more useful to us to have the numbers that are specific to our community.
Yeah, but I understand that you've mentioned that in the past, Steve, and appreciate that. But again, I guess you also know that, we do have patients that maybe at Columbia who are not necessarily from this community.
Well, we know that, and that's true for everything that you treat. There are always people from outside our community. We have a particular interest in knowing how you're dealing with the capacity issues and dealing with people in our own community.
Sure.
So I would appreciate it if you would once again take that back and let the people at the hospital know that this community board is still requesting this information specific to our community and to the 3 facilities in Washington Heights and Inwood.
Sure.
The other thing that would be interesting is knowing where you're diverting patients. So if we could get some data on referrals where you can't treat specifically for the population that might have mental health or substance use disorder issues. So how many referrals are generating out of the CPEP, and how many of the CPEP visits are being treated within the system?
So what was the last thing you said?
And how many of the CPEP visits to the psychiatric emergency room, how many of those are being then treated within the New York Presbyterian system? How many are going out elsewhere? And for referrals, you don't have to break it down for me. I just want to know the number of referrals and how many are.
When you mean referral, what does that actually mean?
Referrals.
Someone shows up at your emergency department. So they go through the emergency department, they're cleared medically, they go into psychiatric. Where are those patients now going? You shut 50 beds in Brooklyn, you shut the 30 beds in Inwood. And I'm curious where patients who can no longer be treated if they need outpatient services, where they're ending up. Are they ending up at the health and hospitals? Where are they ending up? Or are they being referred or discharged to street from the room?
Well, again, I mean, if a patient comes in with the needs to be admitted because of some mental illness, we do have the Gracie Square Hospital, and we also have the Westchester Division where patients could be admitted.
Right. Yes, my
But I'll
question
try to see what the numbers are in terms
is,
of.
how many visits do you have? Something simple would be how many visits to CPEP? How many referrals out of CPEP to New York Presbyterian hospitals? How many referrals out of CPEP to non-New York Presbyterian hospitals? How many discharged to home or discharged to?
No, we'll see what information we could share, Sally.
Thank you so much.
Okay. All right. Tanya, you have a question?
Yes, very quickly, because I know we're getting towards time. I just
Yeah.
wanted to, for Julio, I wanted to point out something Joel Rothschild said. He said you get an address on admission. So in terms of going back to what Steve was talking about in terms of data about this, I think that's a good point. That, you know, them being out of not in our community should not be a problem, because you do get an address when people come in.
Okay, but I tell you, I haven't really drilled down to that. I'm not really asking. I mean, it would be wonderful to know the extent to which local residents are being admitted. Actually, I would like to know that. Yeah, thank you, Tanya. I would like to know.
And then it's just very quickly, I just want to make a quick comment, Julio, and maybe this is Sandra too. You know, we talk about the, you know, people who are hesitant to get the vaccine because of distrust and minority communities, but I think it also is a deeper issue than just educating them on the vaccine and what they do. And I think it's also, I think it'll be important for us to address how people get treated in our medical facilities when they interface with the medical facilities, because that is, you know, I look at root causes, like why do people respond certain ways? And so, you know, when people are not being treated correctly, it can really impact their ability to trust, to say, hey, I'm going to trust you with something unknown, like a vaccine for a deadly, you know, virus. And, but I'm being treated. And I hearken back to that Black doctor who had COVID, who was treated so horribly. She died, but she died. She was sent home, and it was just the way she was treated. She was a doctor herself, a medical doctor who understood this stuff. So I guess what I'm saying is, how are we going to also address that? Like, how are we, you know, make sure that when people are interfacing, that they are being treated correctly?
Yeah. No, I agree with Tanya. I think that you know, there is a bigger issue here in terms of, you know, disparity, in terms of equality, and you know what will, you know, that we had gotten recently a very generous gift to staff and to operate the, you know, what we call now the Justice Center, that will be looking at many of these disparities and finding ways that we can overcome and remove those barriers. So there's more to come to that. I believe Steve met at the last meeting that we had at the hospital, the doctor that's running that, Dr. Julia Isai. And so there'll be more to follow on that, because we feel that, you know, the whole issue of inequality in healthcare, it's a major issue, and we want to be able to address it.
Yeah.
So there'll be more to come to that.
Tanya, yeah, I also wanted pointed out that we at the medical center established the anti-racism task force, and actually we are Dr. Rafi Lantigua and Ori J. Williams, who are the chairs of that task force, will be coming to the board in February to talk about our plan and implementation to look at racism within our medical education, clinical care, and overall medical center campus. So we will be coming to you to show our plan of action to address the inequalities in that area.
That's awesome.
Yeah.
Okay, but this Justice Center is something different, and maybe we could get a presentation, Julio, in the coming months from the doctor who's running the Justice Center. Could you send me some details on that?
Yeah, we are planning. The idea will be that we will be planning sort of an introduction of Dr. Isai and some of the work, and you know, and it's very, very broad. You know, it is not just the, you know, just the aspect of healthcare, but it's you know, how determinant of life, you know, determinant of health, you know, how other things around the community affect affect you in many different ways, not just necessarily health. So it's a very broad mandate that she has, and she's going to be addressing. So, but we will arrange a presentation by the doctor, and to introduce herself, but also to articulate some of those goals that the center has.
Could you spell her last name for me?
It's Shira. Let me. It's
send it to me. Send it to me.
I'll send it. Okay.
Ready? Yeah, and if you're going to send it to me, you might as well include her first name.
Yeah, I'll give you the title and everything. I'll send you.
Give you the whole word. Okay.
Yeah.
Let me just.
Don't give him her email.
Email too. Yeah.
You have to buy the vowels, Steve.
Yes, very good. But Julio, there was an article in the New York Times, a couple of weeks ago, about an issue, the problem that occurred at the Children's Hospital with the dispensing of the vaccines, and some people jumping the line at the hospital because it wasn't the distribution of the vaccines wasn't being carefully controlled. Has that situation been remedied?
I'll look into it, Steve. I really didn't read the article, but let me. Do you have a copy of it?
You're not aware of that? I'll forward it to you.
Yeah, please.
There were a lot of people at the hospital were complaining that they saw people on the line who, by all rights, shouldn't have been considered frontline. They shouldn't have been considered in the first priority category, and they jumped. They found out that all you had to do was run over to the elevator bank, stand on line, and you could get your vaccine. I'll forward it to you.
Okay, thanks.
Okay. All right.
Time check.
What is that?
A time check.
Yeah, time check. All right.
What's my time check? What do I have? How much do I have?
You got 2.5 minutes.
2.5 minutes. Great. So we send you the report, Steve, so you have the outline of the report, but I want to point out in my 2.5 minutes 3 important things that has been happening on our campus as it relates to COVID-19 research. The one I want to point out is our COVID-19 biobank. In partnership with NYP, with the hospital, we have established a biobank for COVID-19 to create centralized resources to collect and process, store, and disseminate biological specimens, biomarkers, and clinical and related data to university investigators. This is critically important for us to begin this work. The biobank was in line to be set up last year. I think COVID presented itself, and both institutions sort of collaborated, and all of our researchers to begin to collect specimens around COVID. This biobank really facilitates the research process for many of our research initiatives. So we will be coming to the committee, Steve, to present on this biobank. As a matter of fact, I, along with Alejandra Aguirre from the CTSA, are co-chairing the biobank community engagement committee, and we would like to come to the committee in the future to present the goal of this center, of this initiative.
Very good. So the specimens, I assume, come from no, I don't know what to assume. The specimens are coming from patients at the hospital. Where are they coming from?
The specimens are coming from patients in the hospitals, are coming from participants that engage in our various research projects, similar to whether it's through our All of Us initiatives and others. There's a whole process around consent and storing and accessing those specimens from researchers that we will love to come back to the committee and speak to, because this is something very, very, very important, as I said, for the future of research and future trials that we want to have in place. Right now, we're focusing on COVID-19, but this is a biobank in general, not just exclusive to COVID-19. It just happens that we started it with a COVID.
But right now, the specimens are coming from COVID-19 patients.
Correct. Yes.
Okay. All right. Okay, that's pretty important. So very, very good.
Right. So we also and presented in last September about the COVID recovery course, which is Dr. Wendy Chang's study, looking at patients who have been, not patients, individuals or patients who have been impacted with COVID, and looking at the health implications of COVID in their bodies and in the future. In other words, looking at what are the health complications that we have to be looking to fight as it relates to how the body impacts COVID, the coronavirus impacts the body, and how the body actually fights the virus, and what we can learn from that.
This is the big unknown, because people are saying that people are afraid that there are going to be permanent after effects.
Well, that's what the Recovery Corps that research is going to be looking at. It's really going to be looking at what are the long-term implications of having had the disease.
Right.
Okay. So then the other one that you really wanted to hear on is our COVID-19 vaccine, our Johnson & Johnson and AstraZeneca trials.
You get 2.5 extra minutes to talk about
2.5 extra minutes. So we completed our trials, so they're ready to be sent for to the FDA. We did 100 people in the Johnson & Johnson, and we did 300 for the AstraZeneca study. So right now we're putting together the research trials for the Sanofi vaccine. This is the other trial. And so basically we're hoping that we should be at some point, once it's approved, the Johnson & Johnson. And Steve, let me correct it. For the Johnson & Johnson vaccine, it is one shot. The AstraZeneca is 2. So once these vaccines are approved, which we strongly believe that they will definitely be more accessible because of their minimal storage capacity, and particularly for the Johnson & Johnson, the fact that it's one vaccine, we believe will have a greater impact in various populations. I wanted to emphasize when the faculty researcher was explaining to us as to why such small numbers. This goes back to the presentation from the Department of Health, is the importance of educating each of the participants. Education in research around COVID has been pivotal in order for us to engage the population. So we want to stress that we wanted to make sure that we're educating the participants to make sure that any vaccines that we're having out there are actually vaccines that people are going to want to use, which is one of the fears that we now have with the vaccine in terms of making sure that people engage. It's not just as Tanya mentioned, whether, how we treat it, is also fears, not of the past, of some people are assuming that we're all thinking of Tuskegee. We also have fears of the present that have people's experiences with the health system. So education has been a key component with these trials, and which is why you see the number so small, because it was very intimate and very engaged populations throughout the trials.
Well, Columbia's got to be just one of numerous sites where the clinical trial is taking place. I mean, this is not the full extent of the trial.
Correct.
There must be tens of thousands of people across the country that are, and maybe in other countries as well, that are participating in these trials.
Correct. And one of the things that Magda, who is another researcher that we will bring also to the board, her position is the more the merrier. She is really saying we need to have a lot of these vaccines out there. We need to figure out what works, what's effective in all populations and communities, because accessibility is a major issue. I think that when I heard of the Johnson & Johnson being just one shot, I think that also increases the ability to be disseminated in low-income communities and rural areas. So I think that once approved by the FDA, this will be very, very important to have out there.
And are you saying that both Johnson and the clinical trials for both Johnson & Johnson and AstraZeneca have now been completed?
Yes. The phase 3 has been completed. It's in the process of being submitted to the FDA for approvals.
And can you say whether or not the the 100 people for Johnson & Johnson, the 300 for AstraZeneca that were participating in your location, were they drawn specifically from the Washington Heights Inwood community? Can we say that this reflects our demographics?
Yes, we can. The 100 and the 300 participants were drawn from this community. I have to say, when we looked at the numbers, we have excellent participation rates in our local community, particularly in Washington Heights and Inwood. We have very good participation numbers, yes.
All right.
And she'll be able to break down the demographics of all the participants once they submit the data in correlation with the other states for FDA approval as well.
Very good. Well, obviously, we'll be interested
Yeah.
in that.
And then lastly, I know Julia mentioned one of the things that we have been doing, understanding that it's not just COVID, that our community, it's community-based organizations and local residents have been tremendously impacted by this. We did increase our neighborhood fund efforts and began a Columbia an NYP food relief program. And to date, we have distributed over $110,000 in awards to community organization, Catholic Charities, Community League of the Heights, Holyrood Church, and others who are engaged in food relief efforts throughout the community as well. We also did the same through the Medical Center Neighborhood Fund with the holiday toy drive. We did not do toys this year. So what we did is work with the different Head Start and daycare centers and CBOs and raise an additional $25,000 to support them in supporting families to get whatever they needed for the holiday season as well.
So you had
and you have the full report.
So well, I forwarded the report to all of the committee members, and
Okay.
we will attach it to the minutes of the meeting.
Okay, good. Because there are some interesting links there that I would want some of you to visit, especially with the Biobank and the Recovery Corps to learn more or to participate in some of these studies as well.
Very good. So, and I appreciate the fact that you go to the trouble of giving us this written report each month. I absolutely appreciate it.
Thank you. We're going to thank Janelle, who's also on this call, who really works very hard to put it all together.
Okay, good. Okay, then I did not mean to thank you. I meant to thank Janelle. And
Happy New Year, Steve.
Happy New Year. I'm sorry that I almost let Sandra glom the credit that you deserve. Again, I should mention by the way, I should mention, by the way, that working with the Borough President's Office, the Community Board was also able to get I think a $10,000 grant for cloth, also to support its food relief efforts. And we somehow managed to win win an award for paper recycling, and $10,000 went to cloth, and $5,000 to the Friends of Inwood Hill Park. Which is known to one of our committee members. All right, thank you, Sandra.
Thank you, Sandra. Stay
Okay.
healthy.
Thank you.
Okay, and if Katie Hanna is still with us, we can now do her presentation.
Hi. I'm still here. Yeah.
Oh, thank you, Katie. I'm sorry that it's taken so long, but can we? Do you have the ability to share the screen?
If you give it to me.
Oh, Paola?
She has it already.
I do.
Okay.
How come I don't see my screen?
All right, so okay, Katie is representing the Manhattan Solid Waste Advisory Board. She came before us maybe 2 years ago.
To the Q&A button.
Yeah, wait a minute. Okay, I think I found the slides. Okay, 1 second here, guys.
Oh, you're entitled.
Let's see, mine, I think I'm in Google, right? Yeah, okay. View, present, I think it says, okay. And is it sharing? Do you see it?
Very good, yes.
Yay. Oh, but it's starting with the last slide. That's not any good. Let's see if we can move this up a bit.
Well, we can go backwards.
I know. Okay. Whoops. All right. Well, here. We'll just do it the old-fashioned way. Okay. So I hope everyone is still awake, although I must say that was very, very interesting. I learned a lot. Okay. So tonight, I'll try to cut this to the chase because I know it's getting very, very late. I am a member, like Maggie, actually, of the Solid Waste Advisory Board. And I know I spoke to you guys maybe 3 years ago.
Was it that long? Okay.
I think it was, yeah. So this is a little bit of an update, and it's also a different focus. It's obviously focused on zero waste. And just for those of you who might not know, SWAB is the Manhattan Solid Waste Advisory Board, which was created back in the late 1980s when the city first established recycling laws. Okay, and this is really kind of a quick overview. I'm not going to get into all the details. I'm hoping I can stimulate your brains, at least what's left of them at this time of the evening. And obviously, I'll give my email. If you've got questions or thoughts, I would love to hear them. Okay.
Very good.
All right. So there's been a lot of talk about climate change. Let's go green. Everybody thinks that sounds cool and groovy, but the sad news is that municipal solid waste has tripled since 1960 in the United States. And as you can see from the chart that's attached here, only 40% of it is currently being recycled. So we have a bit of a problem. And guess what? 80% of US products are used once and then thrown away. And surprise, surprise, the US produces 33% of the world's solid waste. And even though we only have 4.6 of the population. New York City residents generate about 12,000 tons of trash every day, and only about 20% of it is recycled. And the other 80% is landfilled or incinerated. And I find this particular map quite interesting. You can see that Staten Island, the red blob here, their 80% goes to landfills down in South Carolina. You can see that most of Brooklyn is going to either upstate Fairport, New York, or out to Virginia. But my personal favorite is this blue section here, where I personally live in Board 9. You folks are up here in Board 12. And you can see all of the west side of Manhattan and most of lower Manhattan and central Harlem. Where does our waste go? Well, it doesn't. The good news is it doesn't travel very far. Unfortunately, it gets incinerated in Newark, New Jersey. So, you may think you're being green, but the folks across the river do not agree. And once again, I think it shows some problems we have in this country with environmental justice. Landfills and incinerators typically are found in communities of color, and incinerators, as is demonstrated by this photograph, frequently release toxic fumes, and of course methane as well, which is greenhouse gas. I don't know if you remember this. This got a lot of press coverage. I think it was in the summer of 2019, where all over the West Side people said, "Oh, what's that purple stuff coming out?" Well, here it is at the Covanta plant.
I'm sorry, say that again. It's what?
Yeah, it was. I believe it's mostly medical waste, but this is this picture is the Covanta. Well, they call it what do they call it? Maggie, I forget. They have a cute name for it, but it's an incinerator. Okay, and they do generate a little bit of electricity. That's not to say they don't, but it's basically an incinerator located in the Ironbound district of Newark.
Yeah, but why were the fumes purple?
I believe it's because of medical waste.
Wow. Okay.
And then also, even though we have passed the plastic bag law finally in this city and in this state, there's still real problems, of course, with plastic. It's not just bags, and very, very little of plastic is recovered, and most of it's buried in landfills. And much of it, as we know, goes out to sea. And this poor animal is, you can see, is being affected. Another problem, of course, with garbage is that it's expensive. We spend a lot of money getting rid of our waste. And that's true for both tax dollars and also fees that go to private companies who deal with private commercial spaces. So there have to be some solutions to this problem. Which brings us to zero waste. Now, that's kind of a groovy, cool thing to say, but what the hell is that? Well, simply, zero waste is the idea. It's the conservation of resources by responsible production, consumption, and reuse, and it's recovery, okay? So, and that really leads to a circular economy. The whole idea behind a circular economy is that you don't have trash. In a linear economy, you have the same productions going on. You produce this thing, you design it, you distribute it, you sell it, and then it gets perhaps some of it gets recycled, but most of it gets, quote, put in the garbage. It's something you don't see. It's out of sight, out of mind. But of course, that's not true, because as was demonstrated on those slides, it does go somewhere. It goes either in an incinerator or it goes into landfill. So the idea with the circular economy, obviously, is that these products get collected and recycled and get fed back into the economy, so that there is very, very little, if any, quote, trash. All right. So how do we achieve zero waste? Well, as I say, you should follow the R's, and in particular, you should follow the reduce. Reduce is probably the most important thing, is to prevent waste from happening in the first place. And then we can get into reuse and repair, and then recycle, and these other things, okay? So we can reduce waste, as I said before, by preventing it from happening in the first place. And the first thing there is really reducing consumer demand. And we have to make folks understand that, you know, we have to, I think it is a bit of thinking. Do we really need, you know, fast fashion? Does everybody really need, you know, 12 or 20 pairs of shoes? Do you really need to get a new phone every single year? What about fixing it? So the thing here is quality and not quantity. We also have to think about product packaging and product design, getting away from single-use disposable products to reusable ones. Tied in with this is extended producer responsibility, or EPR. And in this case, we have policies that make the manufacturers, rather than the taxpayers, responsible for making sure that their products and the packaging, that they pay for that they pay for how that gets recycled back, that you don't have to pay for Sims Recycling Factory or facility through your taxpayer dollars, but that these manufacturers, and there's different ways of doing this, that they pay to see that it comes back to them, so that the material is reused and recycled. And there's currently a bill, there's a couple of bills pending in committees in Albany about extended producer responsibility. We've already done some of this. For example, there was a paint bill that was passed last year that the paint industry agreed to, and they in turn are paying for, I forget what it's called, the paint. It's a not-for-profit created by the paint industry, but it does oversee the collection of paint cans and leftover paint, so that it doesn't get thrown into landfills. So the concept is there. It's just a matter of enforcing it and extending it to all industries and producers. Now, besides reducing and pushing for extended producer responsibility, another really important aspect of getting to zero waste is reuse and repair. And there are laws on the books now that don't allow don't allow the consumer or repair shops to actually fix things. This is especially true, you may have run into this with cell phones and computers. So there are various laws being proposed now to allow this to happen, which also gets into a whole reuse and sharing in infrastructure. That's also related to this, that, in the old days, we used to teach people how to fix things. There was, I like to think that, there was home ec and shop, and which I kind of remember. And people, my father was a great fixer. But it's something that we don't value. It's easier to just toss it out and buy a new one. I remember seeing a joke about this where, you buy your new computer, and as soon as you pay for it, it's outdated, and they might as well have a bin there for you to toss it in so that you can turn around and buy the latest one. So we have to get out of that mindset, and we have to encourage people to reuse and people to be able to repair things. Recycling is still important, as is composting. Okay, and this is a slide that I know I had shown before when I was here. And it's still about the same with the numbers. Approximately 76% of New York's current waste stream could be easily recycled. And that, of course, includes food and food soil paper, which is 31%. Okay. And of course, you can see in this one, we have textiles, makes up of 6%. E-waste is a small percentage, although it's probably one of the most toxic ones. Hopefully, the plastic shopping bags is now being addressed. So, and construction demolition is something else that should also be addressed. Part of this is also that sanitation does not do a great job of explaining to folks how to recycle or how to compost. So we definitely need more education in that, whether it's, formalized education of kids in schools. I'm a big believer in that. I always tell people I learned to push my chair in kindergarten, and I still do it. If I'm in a meeting and people don't do it, it makes me extremely anxious and upset. So I'm a big believer in schools being involved in, and in public service announcements. I also believe, and this is my personal feeling, that when tenants move into a building, there should be a lease writer that explains how to recycle, and how to do it in their buildings. So what else can you personally do? You can refuse single-use shopping bags, bottles, mugs, dishes, etc. Bring your own reusables. You can repair, reuse, and donate durables. There are a lot of places that will take them. And there's now classes where you can learn how to fix things. You have laws about that. There's also ways to easily recycle textiles and appliances. Obviously, as I said before, you should follow the current recycling rules that we do have and understand them, and make sure that your neighbors understand them. And then we should reduce food waste. One of the problems is people buy a lot of food thinking, because we have big refrigerators. If you look, 30, 40 years ago, refrigerators weren't quite as big, and they were even smaller 60 or 70 years ago. I know when I was in Europe as a student, I was surprised at how tiny the refrigerator was, because people just didn't buy all this crap, and they didn't have to throw it out. Stuff didn't get lost back there. So that's a big problem, of course, in the US with our capitalist system. But anyway, I don't want to go there today. Composting food scraps and yard waste is obviously important too. The city does have these programs. I double checked. They're back they are functioning. They are taking applications. You can go on the DSNY website. If you can't find it, let me know. I can send you the links. In order to get one of these cute little e-cycle bins, because remember, it's currently illegal to throw your computer, your printer, or your cell phone into the garbage. So you can get one of these cute little bins. If your building has 100 or more units, the city will still come and pick it up, even if there's only 10 units. You just will have to store them in the basement in an empty room or on a shelf. And you can also get these refashion bins, and then the city, when it's full, you call the city up and sanitation, excuse me, the entity that's been contracted by sanitation will come and pick it up and make sure that those clothes or those textiles get recycled. Lastly, well, as I said before, you can buy less stuff, waste less food. Currently, as everybody knows, the brown bin program is in suspension. In Community Board 12, there is one facility that's still open that takes compost. That's the Inwood Green Market, which I believe is still open on Saturdays.
Yes.
Yes, I hope. And I think they
composting up until noon.
Yes, I think it's, what is it, 8 to 12 or 9 to 12?
And it's great.
Yeah.
So it's really a gift to the neighborhood. The Ring Garden was the other site that was composting.
Yeah.
The whole thing, when everything closed down, Ring Garden.
Okay. And, and I always tell folks that, you can just store it in your freezer. Take a bag, even if it's a plastic bag that maybe your bread came in or something, and then save that and throw your scraps in there, throw it in your freezer, and then bring it there on Saturdays. Obviously, that's a temporary solution. I'm not happy about it. My own building had a brown bin, which obviously we've lost due to cutbacks. And SWAB certainly believes in that the city must have a mandatory program for this. So I would, or we would, I should say, we would ask that you contact your local elected officials and let them know that you really do want a composting program and that it should be made a priority. In terms of extended producer responsibility legislation, the Solid Waste Advisory Board of Manhattan has not officially endorsed this particular bill. So I would advise you to check it out and to learn more about EPR. I'm not saying this is the be and end all bill. Yeah, we shall see, but the issue is certainly important, and it's something that needs to happen. Whew. Okay, is everyone still awake? As I like to say to my students. Anyway, this is just to get you excited about garbage. I know I'm excited about it, and to please check out our website. It's recently been done over. We have a lot of resources. We have news articles. We still meet, as you can see, it's typically the second Wednesday of each month. Those meetings are on Zoom. If you're interested, you can just click and get onto our list, and then you'll be invited to the meetings. And what else did I want to say? Oh, we're also doing a survey about composting, and you don't have to be anybody who currently does it. We're just trying to find out attitudes about it and what people might want to see in the future, if they have done it or if they feel like they never want to do it. So if it's okay, I'll forward that link to Steve, and maybe you can share it with the committee and possibly with the whole board. Okay.
Very good.
Katie, can I ask a question about the recycling?
Yeah.
Okay. One of the issues we have in Inwood Hill Park in particular is we can't even get recycling done. Basically everything that's picked up by parks, and obviously they have limited staff, so they can't really run a recycling program. Everything that's picked up by them is thrown in the green bags, which means it's all going to landfill. When we do cleanup events, we separate out anything that's recyclable, and then we take it out of the park and find a friendly building or a business that can store it until the recycling days.
I see.
That's a lot of waste that's basically ending up there. What sanitation, their response when we even try and get the recycling bins is, well, when you recycle plastic bottles, they were dirty. It was dirty recycling. We couldn't do anything with it. But there's got to be a way because there's a lot of waste generated in our parks. And, you know, I mean,
And Sally,
and
this is
residents and businesses get fined for not recycling, but this by the city, and the city is not doing its own recycling. So
Yeah.
Is there any?
this is every park.
Yes.
Yeah, you know, I'm not an expert in that. Let me ask other folks on
It
the,
would just be interesting if someone was at least working on legislation that would say, you know, do as I say and as I do.
right. I mean, I think a lot of it is education and signage, you know.
And it's not sexy stuff. No one really wants to fund it. So
Right,
we'll have a scoping meeting and it's, you know, a gift that we get refillable, water bottle, you know.
Right.
But
Yeah.
in terms of getting recycling bins, it just makes me insane.
Yeah. I know a lot of apartment houses, you know, I've seen the maintenance guys spending, or it's usually men, sometimes it's women, spending, you know, at least a couple of hours every week pulling out the recycling because it's put in the wrong
Oh, it's more than a couple hours. It's,
yeah, no, and they don't want to get a fine, you know. So that's why, yeah.
Well, wearing my Parks hat, that is the problem. Is we've had bad experiences trying to keep recyclables separate from regular garbage because people just they don't comply. They'll just throw the trash in wherever they see a bin.
Although I
And,
do, yeah.
And so we have had situations where we've tried it and we've asked sanitation to pick up recyclables and I think as Sally just said, they end up refusing to do it because the recycling bags are so contaminated that they're useless.
Yeah.
So we don't know how to work this thing out.
And if I could, it begs the question, like, is there any action on making the technology better, you know, to separate out garbage and recycling?
Actually, you know, in the MRFs, they are pretty, they are getting pretty damn fancy there. Yeah. So,
because rely on.
yeah, but it's even a problem with composting because you can't throw meat and dairy and that kind of stuff. So there's an
well, you can in the brown bins, you know.
Yeah, because it goes through the high heat.
That program because that was commercially composted, which was pretty cool, you know.
Okay, we have recently installed separate recycling compacting bins in a few places in Highbridge Park as part of a recently completed project, and we'll have to see how that works out. But I'm not very optimistic.
But those are really, but isn't it more just for squishing the garbage, if you will? I mean,
well, we set it up so that there's one for regular trash.
Okay, and then one for recycling.
The one next to it is for metal, glass, and plastic. And we'll have to see if people follow that.
Well, we did a cleanup at Highbridge Park. It was really convenient to have a place to take them that was right on the street.
Okay.
So Highbridge Recycling did well that day.
Okay. All right.
All right, Katie, I have a couple of questions.
I'll try. Yeah.
I don't know if this was just a suggestion that you just came up with, but is there legislation that would require lease riders that would explain to tenants how they should recycle in their buildings?
Well, as a matter of, I mean, no, there isn't, but the committee that I'm on has been talking about it, and you know we are trying to reach out to elected officials on it, you know, and it's messy. You know, I don't think, I am not an attorney. You know, I have worked in the affordable housing field for most of my career. I don't know how enforceable it might be, But it seems to me that still just to have a rider there where you have to lay out the rules and you're forced to attach the right documentation, because sanitation does have some nice flyers now, you know, and so the tenant really has to look at it and the landlord has to think about it, the property manager. I think that's very, very that valuable. I mean, do you think that would your committee be supportive of that, or are you interested in that?
I would personally be interested in it. I'd like to see how it's, you know, what exactly it would be. I'd like to see something that's graphically, you know, that's graphically attractive, not just, you know, not just a lot of words that people will actually look at and to be able to quickly grasp. But I would be, if some legislation gets developed, I would like to, I would be curious to see what it looks like.
Okay, or even if we have a sample, because NY actually does have a sample on their website, but you know, it's just words, which is why I had said we should modify that so that each building could fit it for their particular needs, and then attach, you know, the recycling graphics that sanitation already does. Anyway.
You need the graphics. And let me ask, how do you think? Do we have any reports on how the electronic and textile recycling programs are working? It's very difficult to, unless you happen to have these bins in your building. It's very difficult to, I think, to engage people in participating, and because they have to take this stuff, you know, God knows where they have to take it in order to actually recycle it.
Yeah, I believe the e-recycling is actually, you know, and there was somebody at Swab who spoke, and I don't remember the numbers, but I think the e-recycling in general is actually going fairly well compared to what it was. The other thing, though, which I thought was interesting, and this was pre-COVID, I know that sanitation, and I think, and I checked their website, on at least in terms of textiles, you don't have to be an apartment house. You could be a laundromat, you could be a school, you could be, you know, you could be an office building. If you wanted to have a textile bin, they would be willing to give it to you. So one of the ideas that I had through my work, and which is, you know, on the Upper West Side, where the organization I work for is developing a large apartment house. And I thought it would be good because it has smaller buildings around it to let people from the community know that they could drop off textiles there and drop off e-waste at that building, that we should become kind of a center for that. So, you know,
well, that could be a model of how other people do it, because, you know, very often, you know, building managers don't want people from the outside just walking into their buildings. But if you can work that out, that would be good.
It has a front desk, you know, with it has an attended desk. So that's why I thought it might.
Don't we have a rezoning happening in Inwood?
I've heard tell that we do. It just hasn't.
What about those buildings?
Yet. Yeah.
Well, that's, well, I don't know if we
East Side Ecology Center runs great e-waste recycling. We actually had one set up in Inwood before COVID, and they had agreed to make a second stop at the Dyckman houses. So hopefully that program is back.
Did that ever happen?
COVID canceled it.
Oh.
Yeah, I don't think those, I don't believe they've started those up again, you know.
No, they haven't.
Yeah, which is.
But we're first in line.
Yeah.
But you know, and they do an amazing job, because the stuff that can be saved and repaired, they do the repairs. They know the value, so you don't feel bad that you bought a second printer even before the first one was out of warranty, because you have no idea how to fix it. So.
All right. Any other questions or comments for Katie?
Great presentation.
Oh, thank you. Yeah, and if you do think of anything, just let Steve know, and you can pass it on to me, or check out our website. Okay.
And would you mind forwarding the presentation to me?
Yeah, as soon as I figure out how to do that without sending you my notes.
All right, very good.
Sure.
Okay. All right. Thank you, Katie.
Thanks a lot, everybody.
Okay. And I promise you, we were all awake.
One last question.
You're dedicated, I must say. Yes.
Do you still have any orange bags?
You know, there may be, I'm not 100% sure. Would you like some? If
Yes.
I do that, will you answer our survey?
Yes, I'll answer it many times.
Yeah.
I'll use all my assumed names.
Let me find out about that, okay?
Great,
I'm-
Sally, Sally, I have a few orange bags I can give you.
cool.
I'm using I'm walking around with an orange bag right now.
Good. I'm glad to hear that. Okay.
All righty.
Oh, by the way, I just wanted to mention, and you probably know this, but just in case you don't, the way the community board speaks is through resolutions, whether it's supporting legislation, whether it's a proposed legislation, whether it is supporting ideas that should happen but haven't yet. So pre-legislation. And so if you can think of ways that we can help further your agenda.
Oh, okay. Yeah.
We basically, what a resolution is it basically about 10 to 12 whereases that put facts and then
right.
Sure you've seen them. But it took a long time actually in our committee with the plastic bag ban because there are people that, the objections were, what am I going to do with my kitty litter?
Right. Use your bread bag.
Yeah, that's right.
I use my bread bags for my lunch sandwiches. Okay.
Right.
All right. Thank you very much, Katie.
Yeah, sure. Okay. Bye-bye.
If you see Curtis, say hello to him for me.
I will.
Okay.
Okay. Bye.
Okay. Under old business, the corner project, I've been in touch with them. The proposal that they presented to us about putting trailers out on Amsterdam Avenue is probably is now not going to come to pass because they are apparently close to signing a lease for a permanent space somewhere in Washington Heights. So there may be some news on this very soon. The DEP service request, I forwarded the December report to you. The most frequent complaint in December was about the quality of the tap water, problems with the taste and odor. And then I sent you a follow-up email. The response I got from DEP about what the cause might have been about the declining water quality. To some extent, it appears to be attributable to the fact that there are repairs being made to the Catskill Aqueduct water line. They're replacing century-old valves on the northernmost 74 miles of the aqueduct, repairing minor leaks, doing other work. Apparently, after 105 years of those water lines being in service. Then there are seasonal problems with sediment and other issues. So you take a look at that email I got, and I should forward this to Paola. Do you know whether the office has been getting inquiries about people's tap water?
No inquiries at the office regarding tap water.
All right. Well, I'll forward this to you in case you do get any questions about it. The latest report is on street and sidewalk cleanliness is from November, showing that our ratings for acceptable streets, 92.3%, acceptably clean sidewalks was unbelievably at 100% in November. I also forwarded to you the latest report from the Department of Design and Construction on its remaining project in our community, which is the replacement of gas mains and water mains in the area east of Broadway between 170th and roughly 190th Streets. That project is at 37.5% complete. Is there any other old business?
Yes.
Who said yes? Sally.
Yeah, two things. One is these are questions that should come before the executive committee, but the formation of the Inwood rezoning task force, we're still waiting for that. And as we resolved as a board and passed the resolution, that had to be done. And we also had ideas in terms of a representative from each committee. So if you could just see where that stands. And also, I know there's been a lot of raving about our website and stuff like that, but we still haven't solved the double 2 sites for Facebook, one of which is not the official site, but it has far many more subscribers. So people don't even know about the second site. And I just don't, I'm reluctant to recycle the paper that I have from old board meetings because I'm not sure where some of it exists on the new site. So I know that everyone's been raving about all the work we've done. But I guess maybe I need to explain to me a little bit better how we rave about stuff. And also there seems to be some inconsistency in how different committees are conducting their meetings over Zoom. So I think that probably should be addressed because in some of them you can chat and other ones you can't. And I would say one thing, which is Paola, when you save this and forward this to Steve, can you include the Q&A and the answers? There's a lot of stuff you can select, but that might have been missed during the meeting, but that's very useful. And the list of participants.
Yeah,
All of that-
can I get the list of participants?
Yes.
Oh, yeah, I would
Anything
like-
that Zoom collects, you can get. It's just a matter of it being captured before.
I email that information to Steve every month. That's how, I don't know what he does with it, but everybody, we only have 2 platforms. WebEx gives certain information and Zoom does. And this information you guys can ask, the district manager or the board chair offline, because these are questions that have come up before and some of them
I
haven't
think the
been
one for Paul
addressed.
really useful.
But and as far as the website, all the information is there. I'm not quite sure what you may be looking for, but email the office because I haven't seen you email us regarding any of your inquiries, and we'll be glad to point you to where they are.
Okay.
Thank you.
So Paola, the stuff that you send me each month, it does include the list of participants?
So I guess you're not opening these files yet, and they tend to delete right away. So when you get this information forwarded to you, open it and look at the attachments and all the information that's being sent to you on a monthly basis.
Yeah, if you could.
So what happens? It disappears. It disappears if I don't open it right away?
You can call me or email me offline and I'll give you the information that I have, but it seems to be this way because these are platforms that are not set up to do otherwise.
I've looked at the one, I got forwarded the one that was sent to Parks once, and it's really useful. I can't remember, but I think the list of participants was there, but more important was you captured all the, there's a transcript actually of the actual meeting, and also you got the Q&A or the chat or whatever, depending on the committee head, but it was very useful to be able to go back and review that.
It includes a transcript of the meeting?
Yes. And it also includes.
Don't put anything in chat you don't want other people to know.
And also, yeah, the Q&A is really useful.
No, but the
It is 10, Steve, it is 10 o'clock. I think maybe these technical issues can be solved.
Okay, and I have 2 new business items.
One second. And Tanya, you have something?
Yeah, I do. For just old business, I just wanted to piggyback on the Inwood task force, but I know it could be 5 years before anything happens with that. So in the interest of us dealing with this right now, I just had a suggestion. Perhaps we could look at the impact of the Inwood rezoning on the health and environment side. Like, perhaps we can invite people in and we can talk about like, what is this going to mean? Because now it's law. It's going to happen. It's happening. So
well, that's why I invited DEP to make a presentation on the drainage plan for Inwood, because that's the underpinning of the rezoning plan. So
okay.
I was hoping to have that tonight. Now it looks as though it'll be in February.
Okay.
Do you have anything you want to say about the noise pollution task force?
Yes. We are going to, we've met twice. So we're going to have our next meeting on Monday, the 3rd meeting. We are looking at noise. We've met with DEP and some elected officials regarding legislation that's pending that are, deal with noise issues, or at least the alleviation of some of these noise issues, particularly things dealing with motor altering vehicles, dirt bikes, things like that. And we spoke with DEP regarding the noise code and what's possible there and what in terms of enforcement. And we also are going to be looking at some things specific to noise decibel levels on our meeting on Monday. We are moving ahead to really looking at this issue and to ultimately come up with some recommendations before summer 2021, which might be bigger and bolder and badder than the than last summer, which we don't want. And so we're moving forward and trying to figure, getting our information, collecting our information. We're going to be meeting with stakeholders, with elected officials and city agencies, and then coming up with those recommendations by end of April. So, it's moving along. We have a really good group of people. I'm really really pleased with the people we have as people, we did have an article in Patch, and we're, there's gonna be some more news coming out about us, but there's 21 people and they represent all segments of the community, from small business to schools to elderly and youth. So we are really, looking at this from a holistic point, and of course, Columbia University is also part of our task force. So we're happy to have them and their expertise to help us through this. And if anybody ever has any questions, you can always reach me and reach out. We just, happy to be moved, trying to do something to really address it, this issue, because we can't afford to have another summer like last summer. It's just, we have to have some accountability and a plan and how we're going to tackle this before summer. Is there anything else, Steve, I can tell you? I'm like trying to blank it out here.
No, that's pretty good. All right, new business, Sally?
Yeah,
Oh, wait, can I ask Tanya a quick question?
Yeah, go ahead.
I was not here, but how was it for New Year's?
It was actually not bad. There were some fireworks, but it wasn't obnoxious, at least where I was. Now, there were some people commenting on other parts of town where it was a little obnoxious. The dirt bikes are constant. Like, that's a constant problem. I had a father actually reach out to me, who's a father of a newborn 2-month-old baby, who said, my baby is gonna die. Like, my baby keeps getting awakened multiple times a night because of dirt bikes, so that remains a problem. The altered vehicles remain a problem. The fireworks have, of course, dissipated, but of course that's not going to be for long, because once May hits, we're going to be right back there. So this is where we're at right now.
Okay. Are we ready for new business? Sally?
Yeah, two things. One, WEACT has their members meeting every second Saturday. So if you're not leaving your house on Saturday morning at 10 o'clock, it's a good thing to tune into. Everything's done on Zoom, and you can weact.org. You can find out information on how to sign up so you get the Zoom link. Second, and most important, is Mulchfest ends this Saturday. And Inwood Hill Park is throwing an event where we will have, because there's a chipper at Inwood Hill Park. There's also one at a second site at around 175th. I can't remember what the second site is in Manhattan.
There's no chipper there.
Okay. Anyway, the chipping
but you can drop off your trees at J. Hood Wright Park.
You can drop off trees. There's a huge list. This event will be really fun. We will have the sachets that you can make. There will be mulch that you can take home. You don't have to show up with your Christmas tree. You can just show up as a person without a tree, or
bring your tree. The whole point of this is to bring trees.
Yeah, but it's also to appreciate tree cycling.
Okay.
We will have at our event, we're joined by the Washington Heights Inwood Food Council, and so Friends and the Washington Heights Inwood Food Council will be doing gardens to go, and we'll teach people how to make self-watering planters. We'll also have seeds to plant in soil. We're doing the sachets again, and we're doing a tree care workshop that we just basically start to introduce the Beautify Broadway, which we're going to be bringing to the community, where we loan out tools. It's just to talk a little bit about that and go quickly through the steps of tree care. I'll be doing a tree care workshop actually tomorrow with the Super Stewards group. And then I have a lot of milkweed seeds, and so I will be distributing those as well. And I think that's about it. It's 10 to 2.
10 a.m. to 2 o'clock Saturday at Isham Street and Seaman
Oh,
Avenue.
I forgot the most exciting thing. The New York Test and Trace Corps will be there. So I called them. Remember at our last meeting, they said if we can show up, we'll show up. So they're coming, and they will be there also from 10 to 2 with information about, anything you want to ask COVID. They'll be distributing materials. And also talking about the new vaccination initiative. It's a great graphic, but they can answer questions about vaccination. So,
Okay, I think we might have heard from them tonight. Okay, anyone else?
Maggie Clark had her hand up again.
Oh, okay. Maggie, go ahead.
Well, I've been putting a lot of stuff in the chat that Tanya has been noticing, and I've put up a few other suggestions, but I'm not sure if you're looking at them in real time. You can save the chat. It's very easy to do that.
Yeah,
But
Paola
you
will
have
do
to
that
do
for
it
me.
before you shut
Unfortunately,
down the meeting.
we're on the Q&A. That's different from the chat.
you can
So-
also
Okay.
save, you
Q&A
can save
then.
both.
Yeah, you can save both, but yeah, I'm saying like it's easy. Like if you say if you had chat, like you could just save it and it would just automatically when the meeting is over, download it, the whole thing, the transcript of the chat. So I don't know in terms of the
I'm just asking that whatever I've put up that you save.
Okay.
But I've also, Tanya, been in chat meetings where it doesn't give you the option of saving the chat file.
And I emailed Steve the waste, just so you know, Steve, I did email you 2 things that Maggie sent over with the wastewater
Okay.
regarding the COVID testing. I did email that to you directly. I just copied
Oh,
it
good.
and then emailed it to you.
Oh,
Now
thank you.
she did, there were some other things about the zero waste presentation that's still in the Q&A that I did not email to you yet. So
Okay. Well, it'll be saved and I'll pick it up when I get it from Paola.
And then
Okay.
you'll send it out to all of us before you open up the file so they don't disappear.
I'll do my best.
Okay, thanks, Steve.
All right, Tanya, thank you for emailing Maggie's stuff to me. All right, so it's 10 after 10. We're going to adjourn the meeting.
Steve, I had one more new business.
Oh, go ahead.
It's more for just, I guess, committee consideration. While we're still doing this, through Zoom, can we start at 6:30?
Yes. Oh,
Would anyone object
I would love it.
we did it for that one meeting, but I think we should do it for good while we're still doing it on Zoom.
Is that okay with people?
I mean, it could be hard, depending on work schedules. Like I know, I don't know. Like now it's okay, but he's right.
Yeah,
I
no,
mean,
I think when we start back in person, 7 o'clock.
Yes, gotcha.
It's just 6:30 while we're still doing the Zoom thing.
Right. No, I don't have an objection to it while we're still doing Zoom, but it's just, if it was in person, it's hard to get sometimes somewhere
Yes, for
by 6:30.
I can't. I have a difficult enough time getting uptown by 7. So yeah, I wouldn't want to move it up to 6:30 if we're doing in-person meetings. I'd like to figure out how we can do a hybrid, how we can still do a Zoom, how we can still encourage people to come into our meetings via Zoom if they can't come in person, because the
Hopefully
benefit.
we can, yeah.
We can do a hybrid. We can do a hybrid.
We'll just all be sitting at the table and some people will be in the computer.
Yeah.
I mean, don't we now have that
I did that for years. I did that for years with an international youth development program. We had offices in Boston, New York, Paris, Senegal, Haiti.
Teachers are doing that now.
And education is doing it now, but it's been possible for a long time.
Mhm. Corporations do it all the time with their different offices. 5 people in the conference room and different people at satellite offices. They do that all the time.
All right, well, we just need to be able to keep track of the people who are Zooming in so we know when they want to speak or whatever. All right, it's now 12 after 10.
So that's a yes, 6:30, we all agree, thank you.
Yeah.
It's fine with me.
Well, what's that?
6:30 is when we're Zooming, 6:30 is fine with me.
Okay, you're willing to Zoom at 6:30. We have that. Okay, thank you, Barbara, and everyone else. The meeting is now adjourned. We'll see you in another month.
Thank you.
Good night,
Good night,
everybody
Steve.
from
Good night,
Altated.
everyone.
Bye.
Good night.
Okay, Paola is still here.